Good morning, Holford Health Centre. Sally speaking.
Stopping smoking is going to be one of the best ways of stopping your asthma being bad in the background.
Things I'm not ready to give up.
From one minute to the other, I start shaking. I feel like I'm going to collapse on the street.
You've got to live with this, so we've got to find a way of keeping it under control, yeah.
You can get arthritic changes, but you're very young for that.
Tell him I'm young, because he keeps telling me I'm old.
What other drugs are you using at the moment?
Crack, heroin, bit of cannabis, and that's it, really.
I became a GP in the first place because I like the idea of being part of a community.
I loved it from the word go, and I still love it today.
There's never a dull moment, and you never know what's coming through your door, which is what makes it both interesting and challenging.
Patrick Smith. Yeah. Hi, Dan.
All right.
Hiya. Come on in. Hi.
I've had a pain in my groin. It's been reoccurring over the last week or so.
OK.
And it's been gradually getting worse.
Yeah?
Finding it hard to go to the toilet. And when I have been, the pain increases.
Is it peeing or pooing that's been affected?
I think it could be both.
It can be both. So which is the worst one, then?
Peeing, I think.
Yeah, and when you say hard to go, what do you mean?
Stand there for a while, like, you know, thinking, I need to go, but it's not coming out.
And when you say your problem going for a poo, what's been happening with that?
Same sort of thing.
What do you mean?
Finding it hard to go.
In what way, then?
Well, I feel like I want to go, and basically not a lot really comes out.
Is there any pain in your bottom itself, or in the penis, or your balls, or...?
Well, it feels like it's around the front area.
And you peeing normally when it does come out? And when your bowels do open, do they open normally?
Well, I waited the other day for about 6 or 7 hours until I really wanted to go, and I actually enjoyed that one. So.
what was that, for a pee?
Yeah.
So how can I help?
She's had a temperature over a week, so yesterday was her 3rd day she was sent home from nursery.
How high is the temperature going?
It goes up to about 39. She's had a persistent chesty, kind of almost croupy cough for about 2 weeks. In her nursery, there's a lot of chicken pox, so we don't know whether it's kind of the incubation period and we're just waiting for the spots to appear. I mean...
It's too long, to me, in my opinion, that you don't get...
Well, that's the thing. Yeah, that's what we were thinking, so...
Yeah, OK. Let's have a look at her. Actually, I'm going to ask you to take her dress off, actually, just so I always want to be able to look at a chest. That's great. Yeah, what's this thing? What's this thing? That's sweet. Just have a little listen there, just a little listen there. Good girl. OK. Let's pop this one in your ear, young lady. I'm sure you do it at home as well, anyway, don't you? That's OK now, no fever right now.
OK.
Oh, there's a bit of a cough, isn't there? Yeah. If you just... That's lovely. That's it, just so that I... OK, that's fine. Can I have a look in her throat? Yeah, sure. That's lovely. OK. Yeah, let's have a little look. Little one. Oh, you're poorly, aren't you? Okay, I know, little one. Let's have a little peek. OK, OK, that's it. Well done. It's all finished, all finished. Oh, little chick. You know, she's a little bit chesty, isn't she? We can hear the phlegm when she gives a cough. I think I should be giving her some antibiotics, but I also think I should be just getting urine just to make sure we're not ignoring that. Okay. So I'm going to get you a pad thing to put on her to collect a urine sample. These kits have... This is like a little bag that you sort of stick over the bottom. So it's got a sticky bit that you put over her bottom, and then the bag will collect urine in. So what I need back is a pot with some urine in. Right, so you've got what you need now.
Yeah.
There's a prescription for some antibiotics. Oof. Little chick.
Uh-oh. She's like a little parrot. Thank you very much.
So, and if you're worried in those next 48 hours that she's not right, just bring her back sooner.
Yeah.
But I want us to review her definitely in 2 days.
That's great. Thank you very much. Appreciate that.
Bye
See you soon.
then.
Cheers. Bye.
All right, let's hop you up on the couch. Can I have a little...
I can't walk very far because the pain comes back.
Because of the pain. You haven't thought about trying any ibuprofen or paracetamol?
No, I don't believe in that stuff.
No? I'm going to come and check your balls and your bottom as well, if that's all right. Let's have a little look at them. Is that where it's sore?
Oh, it's not comfortable.
Cough. And again. OK. Can I have a little look at your balls, then?
Yeah.
OK, that's no pain there. I know it's uncomfortable, but that's OK. That's not bringing on the problem.
No, it's not comfortable, though.
I mean, it's often uncomfortable if somebody else is examining you, but whereabouts, could just put one finger on where the worst pain is?
Where the worst pain is usually around about here.
Actually, in the groin, in the muscles here.
That's what it feels like, anyway.
Do you want me to have a look at your bottom? Because it's a bit unusual about why you're feeling that it's difficult to go. Do you want me to check your bottom, or is it? Do you think...
I'm not very comfortable with that.
No. OK.
Right.
Help yourself up then. So your examination's all OK.
Yeah.
And from that point of view, I'm a bit in the dark about why you suddenly got this pain in the groin. I'd like to check a urine sample and make sure that's all OK. So that's the first thing we'll do. I don't think that this would be linked to it, because usually this causes pain in the balls or pain when you pee or discharge, but you're not at risk of having a sexual infection, anything like that?
Oh, No, I haven't had none for a while.
I haven't had a partner for... When was the last time, do you mind me asking? Was it...
About a year ago.
About a year ago. Would it be worth us screening for that and just making sure there's nothing going on there?
Yeah.
Yeah? So you're happy without any prescriptions today? We'll just get...
Yeah, I'm happy with that, yeah.
If you're sure you don't want anything.
No, I can cope with that. All right.
All right?
Yeah.
Cheers, then.
All right, thank you.
Take that to the front desk. They'll get you the pot and book you the follow-up.
OK. Thank you.
Cheers, then.
Ta-da.
Hello.
So she said I should book an appointment with Dr. Boland.
Yes.
I have never, ever been to a doctor in this country.
Haven't you?
No. I am so lucky. I'm such a lucky soul. I do not have any problem at all, to be very honest.
Thank you.
Right, what can I do for you?
So basically, I'm not quite sure what's going on lately. It's been going on for a while, but I think I'm either anemic or diabetic. So I've been treated for PCOS.
Right, OK.
And I also treated for colitis ulcerative.
OK.
So the doctor I went to see with colitis said she pretty much think that I am anemic to go and get it checked.
OK.
But my life ever since then been a bit of a, well, I wouldn't say a roller coaster, but upside down, because I moved 3 times. I've got a new job, dizziness on a daily basis, that's normal.
Yeah.
Feeling sick just from, nothing. And what's even worse is I'm sleeping 12 hours a day, 14 hours a day, and I just feel even worse than before. Just so not myself. And basically, it just got to a point, it just can't go any further like this.
Are you ready to rock and roll, girls?
You're happy to swing that up and do all of that, and you're OK?
Yeah. Zen.
And my thumb starts dancing on its own.
Did you get the pain straight away?
Because I'm a dancer, I get, weird things.
It's just making sure you don't do anything silly. Like
Try not to.
dancing backwards or whatever.
Yeah.
How can I help today?
I had a pain in my leg the other day, and I found a lump there, and I was a bit concerned.
OK, well, let's have a look at this and see what's going on.
I do feel stupid now, but at the time it frightened me to death.
That's all right,
All right with
worry.
my shoes on?
Yes, come and have a lie down. Right. And roll up both your trouser legs, because I'll have a look at both sides.
Yeah, well, that's what I was doing, feeling both legs.
Good slim ankles, though, haven't you, there? OK.
At the moment, yes.
And where was this lump?
Right on the side.
Just this thing here?
No, down a bit farther. There, round about there. And it was quite large. And I couldn't feel anything on the other side.
It's just your bone?
No, it wasn't the bone.
No?
No, down farther. Round about there.
Round there?
Yeah.
So this is where your bone is.
Yeah.
If I go further down here, I can't feel anything abnormal. Do you want to sit up and show it to me? I might not be feeling in quite the right bit.
There.
I can't feel a lump, what I call a lump. We might mean different things.
Yeah, yeah.
I can feel your muscle there,
Perhaps
attaching
that's
into the
what it
bone,
was.
which is normal.
But I was getting pain from it on Monday.
Did it disturb your sleep or anything?
No, this was after I'd got up.
So you'd got up in the morning,
Yeah.
and you thought, oh, that hurts a bit, and you felt there, and you felt that was a bit different.
Yeah.
And then the pain eased off during the day?
Yeah, yeah.
And you haven't had it since?
No.
No.
But I was on holiday last week and I did a lot of walking.
It might just be a
bit
muscle
dancing.
thing. Just a bit
I
of
did
dancing,
wonder
did you?
that after. Oh yeah, I dance. I like rock and roll.
Did you? Good. But I can't feel anything that's abnormal anatomy.
Oh, thank God for that.
If it hurts again,
Yeah.
or it worries you, then just come back into me.
Yeah.
All right?
Yeah, lovely.
So I won't
Yeah.
check your blood pressure this morning after that.
I'm going to a funeral now.
Oh, are you? OK.
Yeah.
Hope that goes OK.
Okay.
Take care, Jean. Bye. Bye-bye.
From one minute to the other, I start shaking. I feel like I'm gonna collapse on the street. Other day, I went to do my food shopping. I was at the paying. I couldn't put my card in because my hand started shaking so much. I started to feel like I've got like red face, like a sweaty face.
And what's happening with your weight? Is that stable, going up, going down?
So it's all over the place. And my appetite just goes up and down as well.
Okay.
Which is obviously not a good thing.
And how's your mood?
Stress is something that's always been part of my life,
Yeah.
but it's more from like childhood effects.
I don't think it's an issue now.
It's always an issue, but I
So
don't think it
no
has
more now.
anything
Right.
to do with what I just told you about the
Okay.
symptoms.
Can I just check your blood pressure?
Yeah, I've had to check it when I came in.
Oh,
It was
right.
pretty
Oh, was
low.
that today?
Yeah.
Let's have a look then. OK, so that's normal. Somebody who's fit and healthy, young, I'd say that's a normal blood pressure, OK. And do you smoke?
I don't know.
No. Do you use any drugs at all?
No.
No? Drink much alcohol?
No.
So you are fit and healthy then?
Trying my best.
Let's have a little listen to your heart and your chest, if that's OK.
Yeah,
This
sure.
is cold, OK?
That's okay.
OK, that's fine. Have we checked a urine sample? Do you mind just doing that, just to check there's no sign of any sugar in there? Let me show you where the toilet is, and you can come straight back in, OK?
Oh, I'll tell you what I got the other day. Marks and Spencer's, half price on chocolate truffles. They're so nice.
I got some for my sister.
Did you? Yeah. Well, I hadn't got some for myself. They don't last long.
No, I was going to say, once they're open, that's it.
That's it. Literally.
This is one heavy door.
Yes, it is. OK, thank you.
Thank you.
OK, so that's reassuring. There's no sign of any sugar, any white cells, any sign of infection or any blood. OK, so what I'd suggest then is we book you an appointment for some routine blood tests.
OK.
And then a follow-up to see your doctor, and then she'll look at the results and follow on from there.
What do you think from what I told you so far, what it could be?
It's not clear at the moment. I mean, the way you describe the way you feel you need to eat, I mean, that can be lots of different things. I mean, sometimes people can feel faint for different reasons. I don't think it sounds like anything serious to me. OK, so if you go to the reception,
Yeah,
book a blood test, and then book a follow-up appointment with Dr. Edge.
Right,
OK?
All right, thank you very much.
No problem. Bye-bye.
Bye-bye.
Ben Rees, please. Hello, Ben. I'm Dr. Edge, and we're at the end of the corridor. OK, do you want to just follow me? Come and have a seat. If It says here that you've come to see me about your eczema.
Yeah.
Yeah.
As you can see, it's like quite dry and quite bad. And like my neck is quite dry.
Yep.
And it just doesn't seem to want to go away.
Okay. Do you have anything to put on it at the moment?
No, I've run out of Cetraban like a couple of days ago.
Okay. Was that all you had, Cetraban?
And I had some steroid cream, but I haven't used that on it.
You haven't? Okay. Let me have a little look at what's affected here. Okay, so it's on your arms.
Yeah.
And they feel really dry. And your skin's all sort of thick from the eczema as well.
And like, if I'm like in a hot room
Yeah.
and I go out into the cold, my skin does sting a lot.
Can I just have a look at your legs? Do you mind?
It's like all the way up here.
And on the backs here, yeah. Ooh, yeah. And can I see your back?
It's pretty much all over.
Have you had it as bad as this before?
Yeah, like it can flare up, and then sometimes it doesn't.
Yes. Okay. So actually, it was me that saw you last year, almost the same time last year.
Must just be winter.
It may be. Do you think you'd recognise that from previous years?
Yeah.
The dry cold is not good for eczema. It's very dry, your skin, so you need quite a potent and oily moisturiser, and just see if we can get your skin looking a little bit better. And the itching's bad.
Yeah.
I'll give you something to take at night to help with itch. I want to give you 2 different types of cream, so I want you to have something for your body and something for your face. We need to treat your face differently. Does your face bother you?
Some days it'll be like almost like normal,
Yeah.
and then some days it'll be like dry around my eyes like it is today.
Yeah.
And then, yeah, it just varies from day to day.
Yeah, that's rubbish, isn't it? It's... OK, so I'm going to get you to come back and see me in a couple of weeks' time so that I can have a look and see how you're getting on with this. And then we'll think again about whether we refer you on, all right? Because you've got to live with this. It's not going to disappear.
Yeah.
So we've got to find a way of keeping it under control. Yeah? OK. All right.
OK, thank you.
All right, then. See you in 2 weeks' time.
At the moment, the biggest pressure facing general practice is that the demand is outstripping the capacity.
We've got an ageing population with complex medical needs.
I think there is a big change coming in general practice.
Technology will play a big role in that, whether that's increasing remote consulting with patients or whether it involves the use of artificial intelligence.
Small individual practices of 2 or 3 GPs who know their patients very well will be lost, and we are increasingly already joining into large conglomerates.
But there will always be a need for general practice, and that need will increase as we try to take the pressure off the hospital sector.
Zabby, please. Hi there. Have a seat. Hi. So your mum and dad?
Mum and dad?
Mum and dad. Stepdad. Right. Okay. What can I do for Zabby?
Okay. He's been complaining of a headache.
Yep.
We did have a car accident. The headache come on after that. So that's been over a month now. For 2 weeks, he's been coughing really, really badly during the day at night time. Been giving him his asthma inhalers, the brown and blue. Doesn't seem to be working. Yesterday, he started complaining of heart problems.
What do you mean, a heart problem?
Had bad pain in his heart, he said. It kept on stopping and going.
Then my spine was, the top of my spine was hurting.
You're in the wars a bit, aren't you? So, just in terms of the headaches, what are the headaches like?
They're like medium, not like...
So where on the head are they?
Just there.
OK. And when do they come on?
It's been like every other day, probably.
OK. How bad was the car accident?
It gave us all a good jolt.
Yeah.
Okay.
We were going this way and it literally just hit near the back
And
wheel.
when did he last see the optician?
He hasn't, actually.
Okay.
No, at school he got checked, yeah.
OK. So anybody with a new headache, I would suggest see an optician. They have a look at the vision,
Yeah.
but also a very good look at the back of the eyes to see if there's any underlying cause to the headaches. I think that's something that we need to do.
Okay.
So you need to arrange that, OK? Any nausea or vomiting?
You were sick yesterday, weren't you, in the shower?
Yeah, it's a big lump of it.
Ooh, lovely.
You swallowed it?
Yeah, by accident.
Can I pop this on your finger? Looks at your oxygen levels. What do you think they are, without looking? Without looking, that's cheating! OK, 98%, that's pretty good. Oh, right, can I have a little listen to your chest? If you take your jacket off. OK, and can we pull this up at the back? OK, some deep breaths. Good, and again. Okay. Right. Have you blown into a special tube before?
Yeah, you got one.
Yeah. So you know how to do. So what's the best you've ever got?
250.
Fantastic. What can you get today, do you reckon?
700.
Brilliant. OK. I like you to be optimistic. Deep breath in, blow as hard as you can.
Oh, not good.
Oh, it was a good effort, though. So, examining him, everything seems absolutely fine, OK? And from what you've told me, there's nothing that's particularly worrying me. I think he's picked up a viral infection that is just making his asthma a bit worse. However, let's see how he goes. Is that all right?
Yeah, that's what I'm dreading. When it comes to winter with him, I'm
Yeah.
literally always on edge because when he was 2, he had a febrile convulsion.
Okay,
I'm really very, very panicky. I can't sleep, especially when he's coughing at night time.
Babies and toddlers can't manage temperature control very well.
Okay.
At the age he is, it would be really rare to have a febrile convulsion. Okay.
Now listen, please.
It was scary.
I bet it was, and you remember that.
Yeah. I was wanting to keep him off of school tomorrow.
Back to school tomorrow, I agree. I agree. OK, oh, very trendy. OK, bye-bye.
So how can I help?
Everything's up in the air.
In what way?
It took for a few days. So I've missed my medication, I had this, everything's just gone up in the air. I feel like self-harming, you know what I mean? I'm starting to cut myself again. I'm paranoid all the time.
It's a difficult patch for you at the moment from the sound of things.
Very much. I got released yesterday from Guy's Marsh prison.
Okay.
Last time I got out of jail,
Yeah.
I ended up getting back on it. So this time I put a few things in place to make sure everything was right.
And have you used at all since you've been
No,
out?
I used nothing.
What's that from?
Burns.
With cigarette butts, or?
Yeah.
So in prison, you were essentially bullied? Yeah?
Pretty much. I need to obviously get back onto my medication.
Yeah.
I need to obviously get back in contact with my job worker and explain, because obviously I missed an appointment with him.
So have you got money?
What do you mean money?
Are you getting any benefits?
Due to get paid Friday. Right.
Okay.
They already tied me over last fortnight because the sick note ran out.
I think the doctor who was asked to do that felt we couldn't do that because we hadn't seen you.
Oh, right.
So I think that we needed to be able to see you before we could issue a longer sick note. Where are you living at the moment?
Staying there. Oh. Fed up, that's what I am, fed up.
I've had an earache now for 4 days, and it was so bad that I was in tears.
Did they say why you were deaf?
A few years ago, I fell down the stairs, fractured my skull.
Went to sleep about 4 o'clock, got woken up about 6. With severe pain, feeling like it's just being stabbed.
Is it painful if I touch here?
It's painful.
Yeah.
You can just touch it if you need to.
My ear just started hurting. No, it stopped.
Can you hear what she said? She said yes. She said, I can hear what she said. I said, do you know what she said? She said, no.
Hi, you don't come take a seat. I thought we'd met before, but I don't know if have we met? I thought I recognised your name.
I don't think I've met you.
Right,
but-
hello, hi.
I came to see Dr. Thomas, I think, last about my ears.
Dr. Graham.
Oh,
Yeah,
Graham?
yeah.
No, you're Dr.
Yes.
Thomas.
Don't worry.
Thank you. And she gave me some ear cum. Hasn't really worked. And my left ear is now in a lot of pain and woke me up last night with the pain. The pain that I've got now, I've had for the past 3 days. It's
Right.
really sore.
I mean, have you had trouble with your ears before, Zoe, or not?
Not since we moved to Bristol.
Right.
In London, I had some problems with my ears, and I had some really great antibiotics. That was a spray or a drops.
Otomize,
and
probably.
it just,
You're pregnant, aren't you?
Yeah, and I'm
Just need to double check that,
So
make
you
sure.
should make sure that nothing clashes.
Yeah. Right, let me have just a little check of your glands under here, if I may. So, you know, pain from the ear can come from different places. It can be from the canal itself, and it can also be from the drum. If you've got an upper respiratory tract infection or a cold or sort of upper viral thing, then that can be associated with eardrum trouble. The other problem with the canals just tends to come on its own with nothing else in particular, but can tend to be a recurrent thing. So it sounds to me like perhaps that's what you've had a bit more of. Anyway, let's have a look and see. So this was the one that was the problem when you saw Dr. Graham?
This one is better now than this one, but it still seems crusty to me.
If I pull on your ear like that, does that hurt?
No.
If I press on here?
A little bit, yeah.
OK. Does it hurt when I'm looking in there and moving that around like that?
Only a little bit right down the bottom, but not too much.
Okay.
Like down here.
The drum looks fine. The only observation with the drum is that it's a bit dull, which would go along being a bit congested. It's not red or inflamed or infected. Let's have a look on this one. Same again. If I just pull on your...
Yeah, this
on
one's,
your drum
yeah,
anyway.
this one's more painful.
Sorry.
No, it's okay.
Here?
Yeah, it's painful right there.
A little peek inside as well. OK, that looks quite angry, and it's the canal that's angry. And again, the drum looks OK, apart from... Oh, sorry, leave your little friend in there. So I think you've got a titus externa, which is an infection in the canal. The right canal looks just a bit dry and eczema-y. The left canal is red. And it's the left one that's giving you pain, isn't it? Now, let me just see. How many weeks pregnant are you?
20.
How many have you got? Is it first, or have you got any other ones?
It's my first... Oh, we're recurrent miscarriage, unfortunately, so this is my 7th pregnancy.
Were your miscarriages early, or what sort of
they were in the first trimester.
OK, so...
And we're under consultant care.
And so 20 weeks were brilliant. Fantastic. So, I mean, it's not like I want to give anything wrong in pregnancy, but I really definitely quadruply don't. That sounds awful, like I don't give a monkey's about the other pregnant patients. So, big red, not recommended in pregnancy.
Oh, well, can't use that.
I'm going to speak to one of the chemists and give you a call back later.
Okay.
So I'm not going to give the Sofradex until I've got this sorted. Is that OK? I don't mean to waste your time, but I would rather get this right, really. Okay. I'll give you a shout shortly.
Thank you very much.
Thanks, Zoe. Thank you. Bye.
What's going on your face here?
I've got it all over my body.
Right.
I've got it all over my body. I can't seem to get rid of it, so... I had him just before I got out of prison because of stress and worrying. Obviously, life going back to the way it is, and then me going off key and just everything else just getting on top of me and just can't cope.
And let me just see your hands and just turn them over that way for me. Just wondering whether you've got scabies or something like that that's making you so itchy. Have you had this sort of thing before?
Yeah, I get it all the time when I've been mixing the drugs and that, and then just everything with depression and just... everything.
Right. I can give you some antibiotics, which will take the infection away. Yes, yeah, I can see.
Like, started from shaving and that's...
Right, OK, well, you've got to leave it alone, haven't you?
Yeah, it's really hard.
Are you able to wash?
You can wash.
Do you have access to be able to wash?
Yeah.
Yes?
Not all the time, but yeah.
Yeah. I think we've just got to try some antibiotics in the first instance and see if we can get your skin a bit better. Does it feel itchy?
Yeah, sometimes.
Sometimes. I don't want to give you more medication, really, but I was thinking if it is itchy, we could give you something for itch.
It's something from a paranoia, it'd be good.
Is that a new thing, or is that something you've had before?
I've had it before, but I've managed to get rid of it. It comes and goes, and sometimes bad.
Is it to do with other medication that you're using?
Drugs, I suppose, and the life I've been through, pretty much.
What other drugs are you using at the moment?
I use crack, heroin, bit of cannabis, and that's it, really.
I think at the moment I want you to get back onto what you were meant to be taking regularly. And once we've seen your urine and we've got you back on your buprenorphine, the Subutex, we can just decide whether or not we do anything else and try and get your skin a bit more settled. OK, so I'll come to the desk with you to ask them to print you off your thing for your next appointment.
Really fed up with all of it.
We'll just have to chip away, yeah?
When a patient comes into the surgery, I'd suggest they really think about what they want to gain from that appointment.
Be aware that we only have 10 minutes allocated per patient and have maybe one problem to deal with at a time, dealing with the most important first.
The one bit of advice I'd give to patients is to never give up. Certainly, having been a GP in the same practice for over 20 years, I am amazed at the number of patients who I thought would never manage to change, do so, and their lives are radically improved.
So what's been happening then?
I woke up this yesterday and I woke up today and it's got worse.
OK.
But I'm prone to chest infections and I've got asthma as well.
Yeah.
Don't help I smoke, I know. Last time I had a chest infection and I didn't take that much notice of it because of my asthma.
Right.
And ended up with pleurisy. So I'm struggling to talk and breathe and I'm like all the time.
So you've lost your voice. What else has been going on?
Chesty.
Yeah, bring out phlegm?
Phlegm every morning, but some of that is probably still my asthma. But when it goes green, that's when
How long has it been green for? Go on, tell me.
A long time.
Go on, give me a...
Like 2-3 weeks.
Oh, it's been bad for a couple of weeks then?
Yeah.
Do you think your asthma has been the cause of this, or is it sore throat? Or?
It's not sore, it's just lost my voice and I'm just like... Okay.
So your asthma has flared up?
Yeah.
Now, but you've not felt...
No, I don't feel generally ill
No,
at
and
all.
you've been to work today?
Yeah, I went to... They was one that told me to come to the doctors.
You haven't been coughing up any blood or...?
2 days ago, I coughed, but it was like in with the phlegm, so I didn't know if it was like where I've retched from coughing and it's come up like that.
Well, that is actually quite a common thing to happen if you've got a chest infection. As long as it doesn't stay like that, and it's only just a one-off when you've got a chest infection and the asthma's been flared up.
Yeah, because I've got steroid inhalers as well.
Do you been using that then?
Yes, I have, but I can't get them until Friday.
Can't get what?
My prescription until Friday because I ain't been paid till Friday.
Oh, I see. Because your oxygen level's OK and your pulse is a bit up.
Oh, is it?
It just probably shows that you've got this infection that's going on. How many are you smoking a day?
I haven't been smoking much because I smoke roll-ups and I can't bother to make them.
OK, well, that's a good sign. Because obviously, stopping smoking is going to be one of the best ways of stopping your asthma being bad in the background.
Thanks, I'm not ready to give up, really.
Why is that? What do you think would need to change for you
I
to...
don't know. I just enjoy it. It's
Sure.
a really bad thing, really, isn't
Well,
it?
I mean,
Enjoy it.
naturally, I'm going to say you should give up, aren't I?
I know,
and I can
know
only
I
encourage you
should,
to do that. But
I have tried to give up.
Well, if you want some more support when you're ready to do that, we're here to help you with that. Stand up and give me a good one of those.
Okay.
OK. 350. With your asthma, in general, before it all got worse a few weeks ago, were you getting symptoms every day, or were you getting...
Yeah, every day.
So you have had that for a long time?
Yeah,
Like months?
That's months, years.
Is it stopping you doing anything?
I struggle to walk because I'm a walker in work, so I walk to people's houses.
Oh, I see.
I have to go down the hill and then I got to go up the hill. So it's like puffing around.
So it is stopping you doing things because...
Yeah, a little bit.
In general or just...
Yeah,
just
really
when
in
it's
general
bad?
because I walk every day and work.
Let's have a listen in. Just stand up for me. Can I lift this up?
Yeah, of course you can.
Can I go under here?
Yeah.
Sorry, cold hands. Deep breaths. OK, have a seat. So you've got loads of wheeze and a few crackles on the right-hand side. Okay. So I'm going to give you some antibiotics and some steroids.
OK.
Let's have a look in your throat. Oh, it's all quite red there. I think probably that's all to do with the coughing, although there may be some infection as well.
Yeah.
Sometimes you can get viral infection that triggers off the asthma, and sometimes it's bacterial. But I think because of the green phlegm and the breathlessness, we'll give you some antibiotics to cover it as well.
Thank you.
And let's get you back on the steroid, and then come and see us in about 6 weeks' time.
OK.
But if it's really terrible, then come and see us again sooner, obviously.
OK, thank you. Oh, you're a good doctor.
Well, I try my best.
Thank you very much,
All right,
doctor.
nice to see you. Cheers then.
Bye.
Bye.
Right, what can I do for you?
I saw Dr. Graham a couple of weeks ago because I was getting pains in my arm and in my fingers here. And she gave me some amitriptyline to take to try and help with the nerve pain.
Do you think that's changed at all, any of that?
It's not as intense, but I'm still getting a bit of pins and needles and a slight bit of pain here, but it's mainly focused around the thumb.
Let's just have a look and see if there's any wasting. So I just wonder if that's a bit less full than that. Do you see what I mean?
Mm-hmm.
If you're getting pain in it, you can get arthritic changes and then the joint will change shape, but you're very young for that, so I think it's unlikely.
Thanks. I take that. You tell him I'm young because he keeps telling me I'm old.
These things are all relative. To me, you're incredibly young.
Thank you.
That's all right. That loss of the muscle there makes me think that actually there is a bit of nerve being affected. Now, I'm just going to hold your wrist down. Sorry. Oh, does that hurt, just doing that? So what I'm doing here is just to see if this makes the pain or the symptoms in the hand come off.
Pins and needles are getting more intense.
They're getting more intense. So your neck is staying completely still as we're doing this, but that's squeezing the nerve here, the median nerve that comes into the hand. So that makes me think it's more likely to be carpal tunnel.
Yeah.
When you do that, as we did, it makes it worse. So some people find that if they buy a splint that holds their wrist a bit like that, it stops that happening in the night, and therefore that's a bit more comfortable. You could do nothing and see if it settles itself, or if you would like, a steroid injection into the wrist just reduces the inflammation there and often sorts the problem. Dr. Graham does a lovely steroid injection.
You just palm her on someone else. Is that because then I'm not blaming you?
Yeah. No, actually, you want
else.
someone who does quite a lot of them. So rather than us all do it once a year.
Yeah.
2 or 3 people do quite a few of them, and actually she's very good. If that doesn't work, occasionally people have an operation and they just release the nerve here, and that sorts it out. Well, why don't we go for that, actually, because I don't want that getting worse.
Yeah.
So go to the front desk and book a steroid injection.
Would I still need a splint or...?
The splint is just for comfort, really. Let's just go up.
And I think I've trapped a nerve here.
Did you get married recently?
I did.
Oh, congratulations. Where did you get married?
We got married in Weston, a church in Weston.
Lovely.
The reception at a place called Yarlington Barn.
It's great. How lovely.
Socks are the bane of my life. Seriously, I've got an odd sock thing at home with all of Adam. I don't know. I don't know where they go. It's just, honestly, all the odd socks go in a big basket. And every now and again, I go through trying to find a pair. And if I've had 3 attempts, I think I've wasted 2 hours looking for socks to go together. That's a lot of time.
What's your men in the house?
Yeah, I know.
So what? And the sizes are different?
I don't know. Fins are easy to find because they're little, obviously, but it drives me mad.
Is your socks?
Yeah, sort yourself. Yeah, I know. That's it.
Lloyd Preston, please.
Hello there.
You've got doctor as well. Are you medical or...?
No, I'm not medical.
PhD?
No, I'm PhD,
Yeah.
yes.
What PhD is that?
Theology.
Oh, interesting. Right,
So
how
you've
are
got-
things?
OK. As you can see, I've been discharged from cardiology.
Which is good.
Which is good, but I still don't know quite what's going on. I thought I'd just have a check-up just to see how the meds are going and so on and so forth. I also had a strange turn on Saturday when I just didn't feel myself. Took my blood pressure, it was about 180 over 98, heart rate 34.
I am concerned about her sleeping because she snores like nobody's business.
I can't sleep because every time I fall asleep, I get pins and needles in my arms.
In 1 week, I sleep for 26 hours, which is 2 or more hours in a whole day.
That's enough sleep for you?
No, not really.
My eyes have gone a bit funny today, but I think it's just pure tiredness.
Is it upsetting your sleep? It's disturbing your sleep?
It's too painful to sleep. I'm walking around the room nearly all night.
I sleep and all the air stops. I wake up, I see no air. I mean, and my heart is going boom, 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 boom.
Hi there, do come in and see. I'm Dr. Cordell. It's your first time here, I think?
Yes, it is. Yeah, it is.
You just moved or moved practice?
I haven't moved practice, no. I've been quite bad with keeping on top of being assigned to a doctor's.
How long have you been in Bristol?
2 years.
2 years, OK. Yeah. What do you do?
I was an engineer and now I'm doing a PhD.
OK. Was it in an engineering topic?
In neuroscience, actually, so I've kind of changed.
Fantastic. What do we need to discuss today?
So it's been a long-term issue, but especially recently I've been suffering from insomnia. Generally, getting to sleep isn't the problem, it's just I wake up very early and then can't go back to sleep. It's not like Fight Club levels of like not sleeping at all. It's normally just long-term. I don't think I've got more than 6 hours sleep in probably more than a month, I'd say. So it's just like a slow build-up of getting more and more tired. It's sort of getting to the point where if I could have some sort of sleeping pill and I could take it occasionally when it's getting bad.
What time do you stop looking at screens?
So it's generally quite late, it'll probably be until about 10 minutes before I go to bed, I will be probably.
Okay. Coffee, tea?
Yeah, I don't drink caffeine at all.
Okay, just ask about alcohol. What would you drink in a typical week?
Yeah, really not very much at all.
No. We also want to make sure that people aren't depressed because that's a common cause of poor sleep. I mean, how would you assess your mood in a general basis?
I'd say I'm generally a very positive person. I think it's difficult to see which is causing what.
Yeah, sure.
But definitely my mood hasn't been as good recently.
So are there things you enjoy in life at the moment? Getting pleasure from your studies, from your work?
Yeah. Honestly, I just think too much. If I wake up and then I'll just start thinking about something. And recently, because of this trouble to sleep, I start thinking about the fact that I'm not going to be able to sleep. And then,
Yes. And then it goes round, yes. So, I mean, your quest was, could you have something just to take now and again if it's desperate? We could do that. It's not something we like doing because our experience of taking medication is that it one pill tends to lead to another. It's sometimes worth trying one of the sedating antidepressant tablets. Now, I don't think you're depressed, but the sedative antidepressant tablets are not addictive in the way that something like Zopiclone or diazepam is addictive. So I think that would be my preference to do that if we're going to prescribe anything.
Cool, thanks very much.
OK, cheers. All the best with the studies.
Thanks very much.
What now you've got to do with this? Got to take it off.
You have to take it off and, yeah, remove the foil. Yeah. Every time I try to pull it off, it kind of slide off. See? It brute force. Tries to make a hole. There it is. You're all right there.
One of the things I wondered is when I went to see the cardiologist last time, they were saying the beta blocker has a short half-life, so that they recommend taking it twice a day. But my heart rate is so slow.
Yeah.
He was quite happy for me to just take.
I think that sounds reasonable.
Is there a half dose of that? Is there 12? I think I'm on 25, aren't I?
Yes, so you're on 25.
Right. Is there a 12 and a half?
Yeah, there is.
Yeah, if we could change it to that, and I can take that twice a day.
Yeah.
At the moment, I'm just breaking them in half. It's probably time for the annual blood test then, isn't it?
It probably is, isn't it? We could check it again then.
Okay.
We'll check your cholesterol, thyroid, blood count. Anything I don't think I've done is vitamin D.
No, I don't recall a vitamin D.
We could check it. I'm not a believer.
Yes.
But some of the doctors say, you know, if people have vague aches and pains and tiredness and they find it's low and replace it, they've had experience of people feeling a lot better.
Okay.
I'm yet to see that, but...
Yeah, OK, well, why not? Why not?
If I get one person that comes back and says, I've been treated with it and I feel so much better, I'll be converted.
Great sample size.
Yes, yes. Really good medicine. What are we going to do about the statin?
I'll take it.
OK.
It's insurance, isn't it?
Yeah.
When I went to see the cardiologist last time, he was quite insistent I should be on it, but...
Yes, in an ideal world you should be on it, but it's if you can tolerate it.
Yeah.
And so it's weighing that up, isn't it?
Yes. I'm living with it at the moment, so I'll carry on at the moment. If it gets silly, I'll obviously come back.
Yeah, good. How are the wedding plans going?
Excellent.
Are they?
Yeah, I'm a chief wedding planner.
Yes, Kezzy said that. She said she couldn't do it, so
No, so I'm done. Yes.
Is it going to be big?
No, it's at Walton Castle,
Right.
so it only holds 50 for a wedding breakfast. It'll be about 50. Yes, nice. She wanted a small wedding. Then we'll have about 100 in the evening.
Right. Cool. Well, nice to see you.
Fine.
Okay.
Lovely, thank you.
Lovely
Nice to see you.
Yes.
Take care. Thanks a lot.
Yeah, see you soon. Bye-bye.
Bye-bye.
I still enjoy being a GP. I enjoy the relationship with my patients, and I enjoy the relationship with all the team at Horfield. Let me just do the door because it's really heavy.
See you soon. Well, not too soon. One bit of advice I'd give to medical students is that it is great being a GP. It's always variable, and you work with great colleagues and great patients.
It's also extremely fulfilling. I think it's a great career.
Bye. Have a lovely holiday.
Thank you.
Bye.
Bye.
Thank you.
As I'm going to retire in the next couple of years, I'd like to see general practice continuing to be a strong and reliable service available to me as I get older and to my family.
Good morning, Horford Health Centre. Sally speaking.
But for over a year now, the backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
I don't know what it is. I seem to be waking up on a morning This is from drugged.
I've noticed this morning her nose was bleeding. You can see.
Terrible snoring, you can keep you up at night.
Does he actually stop breathing in his sleep?
Oh yes, he has stopped.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning.
Hello, Smiley.
Hello, you okay?
You had a happy day already, haven't we?
Oh, yeah, yeah, exactly. It's always a happy day.
I thought that was all Disney stuff.
Fairy tale.
Okay, hello there. Do come in.
Thank you.
All right, you're looking a bit uncomfortable there?
Yeah.
Come and have a seat.
I had a gentleman go inside of the car on Friday, so we went up to A&E.
Okay.
And they were like, yeah, just keep an eye on it.
Yeah.
And if no better, go back to doctors. And it's just, it's not, I just want something to put my head up, if that makes sense.
Mm-hmm. Yeah.
I get a shooting pain, sometimes just going across, but also across my back, about there.
Mm-hmm.
And it's like, I just want some relief, really.
Okay. So were you driving?
I was driving. There was a car parked across bays that way, and we were driving that way. We almost got past him, and he just didn't see us.
Oh, I see. You're going that way, and he pulled out
banged.
into you.
Yeah.
So on the passenger
yeah.
side. Okay.
Yeah.
What sort of speed was it?
Maybe going 10 at a push.
And at the time, did you think you'd been injured?
It was a bit of shock. I got out of the car and it was like, "Did you not see me?" And he was like, "No, I didn't, love." Went to Sainsbury's and I thought, oh, my neck started to smart a bit.
Yeah, okay.
So went up to A&E.
Okay, you're wearing a seatbelt.
Yeah,
You had a neck
always.
restraint on.
Well, the headrest is there, but I'm small, so it's sort of...
They're
I'm in
quite
the space.
adjustable, you know.
I know, but I'm in that... It's not quite the bottom, but you know what I mean, don't you, Teak?
She needs like a half rung in between.
Yeah, and then...
I see.
Yeah, so it's that, do I need a booster seat? Don't I need a booster seat? It's one of those sort of things.
All right, okay. Okay, just swing around your chest like that. I just want to check your arms and your hands first of all,
Yeah.
actually. Can you just show me your hands like that?
Yeah.
Okay, don't let me push them together.
I've got arthritis now.
That's okay.
Yeah.
Squeeze my finger tight as you can. Down.
Ah.
Don't let me lift your hand up. Sorry about that. All right.
How are things going?
Oh dear, well, during winter, when it's really cold, my fingers tend to be really, really pale. But lately, if it even rains and it's a bit chilly, it tends to be numb. Yeah.
Do you get change of colour with it when it does that?
Yes.
It goes
so
white.
Really,
Does it go
really
blue
white.
and
No,
purple
it's
later?
just white.
Just white.
And
And just on the
sometimes-
tips of all your fingers,
Yes.
because they feel cool to me now.
Yeah, and,
it's
I'm
painful.
always yeah, it's really painful.
And it's worse when it's cold and rainy and
That is it.
winter.
Yes, I don't know what's wrong with me.
Do you know what that you don't know? Because I'm sure that the diagnosis is Raynaud's syndrome.
Oh.
Have you heard of that before?
No.
Well, it's a common problem affecting around 5% of women. But it's the spasm of the blood vessels as they supply the tips of your fingers, and it's set off by the cold. And it makes them go white, and it makes them be painful, and
painful.
it's basically everything that you're describing.
Yes, it does happen. I was like, it's something wrong
Shall I
with
write-
me.
I'm gonna write down
and I
the-
can have a read about it myself.
Go and have a read, because
Yeah.
you'll see. And there isn't a magic fix, though you can try gloves and keeping your hands warm and things like that, and you can try some medication for it if it gets really bad. Go and have a read about the treatment.
Okay, I will surely do. Oh dear.
Occasionally, it can be linked to other more generalised illnesses. So if you read up on there, it will tell you what those are. They're much rarer, but they would need another blood test if you had some of these other, kind of symptoms or problems, swallowing problems, generalised joint pains.
Okay.
But if it's not doing that and it's just isolated Raynaud's, then it doesn't need us to do lots of other tests at this
I'll
stage,
read
unless it
about
gets
it.
really bad, in which
Okay.
case we'll see you again.
Okay, I'll read about it.
And then let me know.
I shall let you know. Oh, God. I think you have
Fingers
to see me
crossed,
all the
Janet.
time. I hope you're not tired of seeing me.
No, it's absolutely
Do
fine.
you mind
don't
if I
worry.
check my weight on the...
No, that's fine.
You
Just
sure?
you'll need to tap on it just to turn the scales on.
You know, after I left here, I've been really working hard.
Great. Well, fingers crossed then.
Fingers crossed. So hopefully, it's make 72.
How's that?
That's good because that time it's 72.6. It was 74 the last time I came.
Well, there you go.
So I think it's paid off.
Yeah,
Thank you
well,
very much,
done.
Dr.
Nice to
Pelly.
see you. Bye.
Okay, just turn your head slightly that way.
Yeah. That's hurting. You've got to say when it hurts. I'm sorry.
Yeah, say out, because I can't see you very well.
Sorry.
Okay, so if I turn it that way.
That's a bit sore there.
Okay, if I turn it the other way.
Sore there.
Okay, but it feels like it's moving reasonably.
Yeah.
Actually, you can hold your head in neutral. It's more comfortable to move it that way.
I just need something like a constant pillow would be lovely, but I can't seem to find.
Have you tried making your own?
I mean, I put the rabbit that I have in my bag underneath, and that's quite nice because
Yeah,
it feels lovely.
Yeah, that looks like good medical device, doesn't it?
Yeah, I thought so. It's just I just need something soft.
Okay. Just to say what's happened here, I mean, this is a common thing. If people are in a road traffic accident, often you get a little bit of jarring in the muscles, and it can be surprisingly uncomfortable for a day or so.
That's what they said,
Maybe even a week or so sometimes, but I don't think it's going to be that long with you. And I don't think there's anything serious damaged here, and I think everything's going to come right. It's sometimes helpful to have an anti-inflammatory gel to rub into the muscles.
I've still got some from before. Am I allowed to use it?
Yes, certainly use that 3 or 4 times a day, actually.
Okay.
That'd be fine. We can't prescribe you a neck collar, and actually we really wouldn't want to.
As stupid as it sounds, I do have a collection of teddy bears. I might just try one of those.
Okay, teddy bear therapy.
Yeah,
that'd be good.
There you go.
Okay, and then I'll give you a sheet with some neck exercises.
Lovely, thank you.
All right?
Yeah, maybe you could sell them in a little sort of shop on the side.
Oh, yeah, we could do that. Everyone needs a teddy bear or two.
You'd buy them all. I would buy them all.
There we go. Jolly good.
Thank you. Thank you very much.
Okay, now I hope the car gets better soon.
Oh, the car's getting taken away. Monday. It's going to be fixed.
Okay. Jolly good. Bye-bye.
Bye.
Hello, I'm liking the wheels. Yeah. I tell you what, can I swap? This is killing me, this.
Christopher Collins, please.
Sorry, I couldn't do much. I've been doing it all night, this.
And then you struggled, not to worry, coming in.
So when you've got to go, you can't go. When you don't want to go, you go a lot.
Have a seat.
I've been terrible all night, I tell you.
Oh, dear. So tell me what's been happening.
Basically, it started in the afternoon, about 3. I was weeing. I couldn't control my urine, and throughout the night from the evenings, it was doing it all the time.
Right. Okay.
I weed this morning at about 9, and a lot came out.
Okay.
I actually weed into a bucket in my room because I couldn't make it to the toilet.
Oh dear. Should we have a little listen? Where does this go?
What's it?
Yeah, fantastic.
You take nice deep breaths with the open mouth.
Can you say 99 for me?
99.
And again?
99.
And again?
99.
Nice deep breaths. Oh, there's some serious static going on.
Nice.
Morning. You have to sit on this one because it's usually this here. Hi. She woke up this morning and her heart was racing, like I did like her pulse and things. And then she was led in bed. She was literally just led in my bed and she was like that. She was breathing really fast.
She was kind of panting.
Yeah, as if she'd just been running. And then she had a really bad cough yesterday, didn't you?
Yeah.
Stay here because he's got to see you.
So yesterday she was coughing.
Coughing a lot. She's normally quite happy walking around and running around. And then all of a sudden she'll just want to lay down for half an hour.
She had any temperatures at all?
Although she didn't have a temperature, she was sweating, but she was like not hot to touch. So I was like, that's not normal.
And was that at the same time as she was breathing more quickly? All right, Karina.
I'm
Do you think you could come and sit on this chair? What a start. Right, have you seen one of these before? This is called the stethoscope.
It's magic.
I'm going to listen to your heart to start with, which is there. And it is beating.
Shh. He's got to listen to Sissy.
And it's beating nice and regularly at a normal speed at the moment.
Okay.
Now I'm going to have a listen at the back.
It's going now.
So both our heart and our lungs sound completely
You're
normal.
supposed to breathe for it.
Let's see what your temperature is now.
Freeze.
So temperature's 36.6.
That's good.
Which is good.
That's what we want.
Yeah. Right, now I want to have a look in your mouth. So I need you to open really wide for me. Can you open a bit wider?
Open as wide as you can.
Don't puke.
Does it feel sore at all in there?
Does it hurt?
Shh, let her listen to the doctor.
Okay. Looks a little bit red.
Okay.
And I can feel some little glands enlarged in her neck. Okay, we're all finished there. You can go back to playing if you'd like. So I think the first thing to say is I don't think there's anything too serious going on. I think probably she is brewing an infection, which explains a lot of the symptoms, and it's here upwards rather than there downwards. Throat looks a bit red. Her breathing going a bit quicker, coinciding with perhaps having a temperature. I think those two things often go hand in hand. Fast breathing or panting, if that's on a sustained basis, if it's not getting better quite quickly, is definitely one of those things that we do take quite seriously because it can be a sign of more serious infection.
Yeah. Really?
OK.
We're finished now.
Wait.
Take care, guys.
We can go now. Say bye. Say thank you. 3, 2.
Oh, am I getting
Good
that
girl.
back at Will?
Yeah, please stop. Big pull.
Oh.
Thank you. Be back for a broken
Yeah,
leg
no, I was
later.
just thinking that. See you soon, bye.
Good girl.
If you pop up on the bed, can I have a little feel of your tummy? And are you drinking okay?
Yeah.
Yeah. Okay. Okay, can I have a little feel of your tummy?
Yeah.
Yeah.
Could you do the bathroom?
Are you not able to? There we go. Okay. Have you got any pain there at the moment?
No.
No. I'll just have a little gentle feel around, okay?
Okay.
That's fine. You can pop your stuff back on. Do you want me to do the button again?
Please, yeah.
There we go. So you just do your zip, okay? And get up when you're ready. Okay, so this is showing a lot of white cells, some blood and some protein, so that is probably a urine infection. So it's really important to drink as much fluid as you can. Take paracetamol if you get any pains or fevers.
Okay.
Is that okay?
Yeah.
Antibiotics, 1 twice a day for a week.
Okay.
We're treating it as a urine infection, but it's a little bit more unusual to have a urine infection in men, so that's where it's really important for you to come back next week and check that everything's resolved, all right? In fact, if I give you another urine pot to come back with next week, bear with me, I'm just going to get one, all right?
Okay.
As a urinary tract infection in men is more difficult to get, we do worry, could there be something more underlying? Things we'd worry about are blockages or any potential cancer in the bladder. This was the first time I'd met Mr. Collins because he's not my registered patient. I could tell that he suffers with a mental health illness. I can see this from his notes. UTIs and other infections can cause confusion and can make mental health symptoms worse.
This is the truth. I am possessed, not by demons, but a state of telepathic communication. Others may try to use it.
There we go. So if you do another urine sample and bring it back with you when you come next week.
Okay.
All right, there
Thanks
we go.
very much.
So take that to the desk and they'll book that appointment for you.
Okay, thank you.
Okay, let me get the door.
Cheers.
Okay, all the best.
All right, bye.
Bye-bye.
Oh, sorry.
Just had a spillage.
Okay, what can I do for you?
Open your mouth for doctor, please. Can you see his tonsils?
I can't from here, but I'll have a look in a minute.
Okay,
Yeah,
they
so
are huge.
tonsils remain huge.
And terrible snoring. You can keep you up at night.
So that was the next thing I was going to come
I
to.
can keep anybody up at night.
The other
Can you?
Yeah.
Are you a great snorer? Can you do an impression of your snoring? You're a great snorer. Fantastic.
Sometimes when he's really tired, he'll get to a point where you think he stopped breathing. He'll go in,
Yeah, well, I was going to ask you about that. So this is at night, you mean?
Yeah,
In at
yeah.
night, yeah.
So he'll go in, and you think, oh my goodness.
Can you do an impression?
So
of
you'll
it?
do. And you're thinking, when's it going to come out? And then he'll just go.
Okay. Does he actually stop breathing in his sleep?
There's been nights when I've actually checked on him thinking, what's happened?
Yes.
So yes, he has stopped.
Alrighty. Can we have a look at you?
And certain things seem to bother him. Certain types of music, not all types.
Okay. I have that
with
problem,
like a
but
heavy
yes.
sort of bass.
Yes, okay.
Can't take it.
Did you hear that Mummy was saying?
No.
So sometimes when you listen to music, you find it a bit difficult. Are you aware of that?
He dances to the music at home.
Does he?
When crazy.
Okay, tip your head back slightly. Let's have a look at these amazing tonsils that Mum's been talking about. Good lad. You're absolutely amazing, aren't you? I mean, I think this lad should be seen by ENT. He has got large tonsils. They're not the largest I've seen by some way, but they're quite large enough. So, yeah, it all ties in together. He is, in an old-fashioned parlance, what we call a coryzal child, a child who's got big tonsils, got big adenoids, got slightly nasal sort of speech with it, and it's a syndrome that goes together. And I think ENT should be seeing him and deciding whether his tonsils and adenoids need to be removed.
Okay.
Is that all right?
Yeah, perfect.
Yeah. Okay.
Anya.
We'll see how it goes. All right, but I will get a referral letter off.
That's brilliant.
Okay. Cheerio then.
Thank you.
Bye, folks. Bye. Bye.
Bye. Right, come on then. Home.
Oh. I'll have to take phone calls in here. Hello?
Valentine.
Yeah. Okay, I've got to go. I'm going into the doctor's now. Okay. Speak to you tomorrow. Okay, bye-bye. Sorry, that was the...
That's all right. Hello.
Hello. Long time.
Yeah. How's it going?
A bit up and down.
All right, come on. Okay.
Some positives, some negatives. Okay.
All right. So, what can I do for you today?
Why ask you if you can help? My last Laurel's appointment, I talked about the gender recognition certificate. I need a supportive letter, one from my GP. I think it's just basically needing to know that I've been presenting myself consistently as female.
As I've said to you before, I am going to be quite happy that this is something that you've presented to me consistently, so you don't need to worry about me signing it when the time comes. All right?
Yeah.
So,
for a panel,
application for a gender recognition certificate, OK?
So that's that. There's another thing. I talked to him about operations.
A breast construction.
Yeah, OK. She gave me two things that she required from me. One was to lose weight, and I've actually lost quite a bit of weight. I've reached the goal where she requested what I need, because no surgeon will touch me or go ahead with anything unless they can verify that I'm physically fit for it. You know, physically, not mentally, but physically fit.
OK.
And
There'll
I'm
be
happy
no reason why you can't physically have an operation. Mentally, that's more a different thing, you know, whether it's the right time psychologically for you. That's more for the Laurels to consider.
My question of mental health, I'm not questioning about my gender and the dysphoria. And, you know, that part of it, like, I'm quite stapling.
Well, I think as
you
long
know.
as the laurels agree with that, then that's probably going to be fine.
The question is over the mental state
Why
of
don't you?
all the other
Why don't you
things.
talk to them?
So if I discuss the mental side of it with them, and then go back to have the appointment.
Yeah, and then if I get a letter, there won't be a problem.
So to say physically, I am physically.
Okay. All right, Valentine. I'm with you all the way on that.
Okay then.
Okay.
I'll get. Yeah, great.
Okay, doke.
Thank you
All
so
right,
much.
well,
thank you.
That's all right. Okay.
Yeah. Okay. Thank
all
you.
right then. See ya.
Okay. Thank you.
Bye bye.
What can I do for you, Julie? You need a new name badge.
Why?
Yes, going to order you one. It's got to be yellow.
They got to be white. But then I had mine recently because they'd ordered it and they spelt Jackie wrong. Don't do the IE.
Hayley Beatty, please. Hello there. I wasn't hiding. Coming in. Thanks for waiting. I was having a little look at your notes.
That's okay.
Have a seat. Right, what can I do for you?
I've been having episodes, like last night, for instance, like I'm final day, my normal happy self, and then something just switches and I just cry, I can't seem to lift myself up and I can't find a reason for why I've just changed either. Like, nothing happened in the day yesterday. I'm having ongoing problems with my neighbours, which has been going on for a while, and I'm trying to move. But I sort of put my Cody to bed, and then it just went down from there.
I've had ingrown toenails for quite some time.
Right.
And I have been cutting them out myself.
What do you mean cutting them out?
Trying to cut them as good as I can.
Because I'm on my feet a day at work,
yeah.
Sometimes it is really uncomfortable. I just want to put my feet in cold water.
So as I press down here, is it okay there?
Have you ever had one of these before?
Yeah, and back home Pakistan, I have a both nails.
Oh, yes.
They took them off.
You don't want that again. No, that's horrible, isn't it?
Usually they're like really like pussy and like
I think it's because earlier I ran on the field and I felt something hurt on my foot and it popped.
What have you done?
Okay, so I noticed that my big toenail was getting a bit thicker, so starting to grow extra layers.
Okay.
And I noticed that on the other big toenail, on the other foot, and they've continued to grow layers.
When you see them, you understand.
Okay, so...
This has got really thick, hasn't it?
Yes, but it's very loose.
Let's have a look at your other one then. The nail is obviously very thickened. Oh gosh, yeah, you have got layers, haven't you? Yeah. That's strange.
Yeah, no, curiously, my wife has very thick toenails. We think it's possibly a hereditary thing.
How loose are they?
The first top layer sounds very hollow.
So, I mean, I think that these layers is pretty much dead nail. I think what's happening is that you've got a chronic sort of detachment of your toenail for whatever reason, and then I think it's basically just not coming off fully, so then it's just attaching to the one underneath each time. The only thing you're going to be able to do is go and see a podiatrist.
Right.
Really, and then they'll be able to treat them and sort it. I think the main thing is going to be to file them down.
I think it's an angle grinder time, isn't it?
There's no infection or anything like that, so it's not anything that's causing a risk to your toe or anything like that. Can I take a photo? Then I know for future reference if I ever get any 16-year-olds with the same toenail problem in ever again. It's quite interesting. Layers, isn't it? Like an onion.
Yes, it is like an onion. Didn't think they'd be having a photo shoot today.
There we go. A podiatrist will be able to sort them out, and then once they've sorted them, it's going to be a case of just keeping them filed down so that they don't get really thick.
Oh,
thanks for your time.
help.
You're not the only one with weird toes. My friend has toes that look like thumbs.
Oh, wow.
They're really weird. Who's teaser? See you later.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning because I can't settle and but I had no explanation as to why. It just switched like that.
So how long has it been like that for?
About 4 or 5 weeks now.
And you've suffered with anxiety in the past, haven't
Yeah.
you? Are you on tablets for it?
I'm on sertraline, yeah.
100 milligrams. Now, how long have you been on that dose for?
Quite a while now.
And what's happening with you at home at the moment?
I'm having ongoing problems with my neighbours, general intimidation. You know, I have to walk through them every day because they sit outside. I've been on to the council, the housing officer, so I'm hoping to be moved soon. So I'm just trying to keep myself to myself. I'm walking through them now because at the beginning I was shutting myself in and I didn't want to come in, but now I kind of hold my head high and I just walk out. I had complaints. I've got cameras. They put cameras up, and I've got one that faces up the drive, which is fine, but now I've got one that goes towards my front door. So it's like I have to live like I'm in Big Brother.
Right. And is it just you and your...
Just me and my son, yeah.
And how old's your son?
He's 3, yeah, coming up 4.
Any nasty thoughts about harming yourself at all?
No. Back in the past, in 2009, I did go through a stage of that, but I think my son keeps my head above that level.
How would you feel about trying some counselling or talking therapies?
Yeah, I did get in contact with one, but they were supposed to phone me back and they never did. I'm not very good on the phone, so I'm not very good at...
OK. Maybe it's something to look at again.
Yeah.
Because I think you're going through a lot, you know, with your neighbours and, you know, single mum as well.
Yeah.
You know, it's hard. So you can email them. OK, you don't have to ring them.
Yeah,
so that's the first step. You could do that.
Yeah.
Then they do like to chat on the phone, the next step. OK, but you can give a specified time and, you know, when you're at home safe and you can listen and that sort of thing.
OK, yeah.
And so you try and contact the Bristol Wellbeing Therapies. Either come back and see me, Dr Ramshaw, or your own doctor in, I'd say, 2 to 3 weeks.
OK, yeah.
Is that OK?
Lovely, that's brilliant. Thank you.
Nice to see you.
And you.
OK.
Thank you.
Bye-bye.
Bye.
Can I help?
See a question. Do you do nail cutting here? Toenail cutting?
We don't. Age UK, look on...
Oh, Age UK. Bear with me 1 second.
Oh, that's all right.
Find the number for you.
That's one thing I can't do. I get the clippers hanging like this. Oh, God.
Aha, so it says 15 pounds.
I think I'll struggle on, don't you?
OK.
Right, I don't know what it is. I seem to be waking up on a morning as if I'm drugged. And I do tend to get giddy. I seem to lose my balance rather a lot. Luckily, I can hang on to things as well. But if I get up too quick, obviously. I've got, I think, I don't know, high blood pressure. I think it's low blood pressure.
And how long have you been feeling a bit dizzy?
A couple of months, to be quite honest with you.
OK.
I'm 76 now. So it frightens me a bit. And I didn't know whether I was taking too many tablets. So I feel as though I'm taking too many tablets because I'm taking sort of either 14 or 15 on a morning.
So if you get up to move, is that when you feel a bit dizzy, or is it when sitting still?
I go to get up and everything is disorientated.
OK.
I know where I am.
Yes.
But it's just getting from point A to point B.
Things. OK.
You know, and it tends to frighten me. I think I'm going to faint over in a minute, you know.
Once you've sat down, if you're sitting down, do you feel all right?
Fine.
OK, so it tends to be when you've got up to try and move around that you can't, that you're a bit unbalanced. Do you want to slip your jacket off for me so I can just have a listen? Lovely.
OK.
Yep, that's perfect. OK, let's just have a listen. You can breathe normally. I'm just listening into your heart for now. That all sounds fine. Let's check your blood pressure.
OK. As you can see what the tablets are doing.
Yeah. To be careful with you, don't we? You've got delicate skin.
Yeah.
138/71. That's OK, but maybe it's a little bit low for you at the moment. Yeah, so you've had high blood pressure, a regular heartbeat, and a stroke in the past, and you've got the lungs. OK.
Yeah.
You're on perindopril, and that lowers blood pressure.
I did 2 milligrams.
You're on 8.
8. She put me up to 8 because she said the arteries are too narrow.
Yeah.
And she wanted to open the arteries to allow the blood to go through a bit quicker.
Yes.
So she said, I'm going to up it to 8.
That was about a month ago.
Yeah.
I just wonder whether that's what's made you feel a bit unsteady. whether just that increase in dose, because that would fit with you feeling like this
Would
for
it?
about a month. Yes. I'm going to get you back down on the 4, just to try to see whether that makes a difference to this dizziness.
Yeah. How long is it going to be before I start noticing, if there is going to be anything, a difference?
A week? Yeah.
That's brilliant. Thank you very much. Thank you.
Is that okay?
Yep.
Great.
Have a good day.
Thank you. Bye-bye.
Thank you for seeing me. Thank you.
OK, come and have a seat. What can I do for you?
Well, I've got like these random spots
Yeah.
coming about before because they were like they thought they were acne, but they seem to be like spreading like up here. They're in my eyes and stuff. I think they're in my ears, and they're really like itchy.
All right, and how long have you had them for now?
Maybe about 3 weeks. They just started on my arms, but I don't know if they're the same thing. But they're like, I've got tiny little ones in places that you can just feel like digging in, like
OK.
almost in my mouth and stuff. So I don't know.
So it's itchy spots, you've had them 3 weeks and they're getting worse.
Yeah, and
we've
then
not
like
tried any particular treatment for them so
no,
far.
it was just cream. Like they said to get some. They thought it was acne to get acne cream, so I just got like
Yeah,
went to the
it's obviously-
pharmacist. Like I've been
Should we look at
scratching
your
here.
arm first of all?
Yeah,
I'll probably
they're-
look under a bit of magnification.
No, that's fine. And then some of them are like really, really tiny ones.
OK, let's look at this eye. Okay, what's your general health like?
Okay, I think.
Okay. Some of these you've scratched, I think. Is that
Yeah.
right? Would that be right? Is that one not scratched and that one
Yeah.
not scratched? Okay. All right. Where else have you got some good ones to look at?
Do you want to see my back?
Yes, that's sometimes helpful, actually.
And my armpits are really itchy at the moment, so I don't know if they're in there.
Okay.
Sorry, it's quite bad.
OK, let me just have a look at this. Again, I'm just going to look under magnification.
Yeah, no, that's
'cause
fine. I think the more I
often-
touch them, the more itchy they are.
I think that's often the case. So when I look under magnification, what we see is a little red spot, often scratched, often with a bit of inflammation around the spot. And they look like septic spots. In fact, a lot of them look like something called folliculitis, which is where the hair follicles get inflamed and the bacteria have got sort of scratched into the hair follicles.
Around my legs, around my hair on my legs.
So this is a little bit tentative of what I'm going to say, but quite a lot of these spots would do for what's called folliculitis, little bacterial infections. So they're hair follicles which have got infected with staphylococcal skin bacteria. Okay, don't look fine. We've all got those. We've all got them. It's just some people they cause trouble and some we don't. Okay. I suspect you've scratched your legs. Maybe you've been a bit hot and sweaty, you've scratched somewhere else and you've just spread the germs around and this thing has...
Is it contagious?
Not desperately so. I won't say zero contagious, but not desperately so. Okay. So these are the things I'm going to recommend, OK? Firstly, I'd like to recommend that you cut your fingernails as short as you can, at least once a week, and file them down most days so that should you be scratching, you can't be breaking the surface of the skin. Try and train yourself not to scratch these spots.
Just leave them.
Don't leave them, or if you can't bear it, just slap them, because slapping will relieve an itch a bit. Thirdly, I suggest we give you a course of antibiotics, and we'll do at least a 2-week course. I'll give you a small tube of a cream with an antibiotic in it that you can use on particularly itchy spots if they're really driving you crazy. All right? Then I think it would be prudent to get blood tests done, and particularly interesting to check for diabetes or getting towards diabetes.
No, that's fine.
Because that can predispose to this sort of thing. I hope that things will turn the corner with that. If they don't, we'll see you back.
Okay,
all right?
I'll wait back. Thank you ever so much.
Cheerio
Thanks
then.
as well.
Bye-bye.
Thank you.
The printer's not working. Do you know what it is? Oh, that's all you had to do? Oh, what's going on here? Private prescription. I don't know why it's coming out 100 times.
Right, I'll put that up now and it should work.
That is lovely, thank you.
If it was a nice, easy one, I could do that.
Come and have a seat.
Breathing problems again.
Okay.
I think I've got another chest infection coming.
Okay.
I've fed up with it now. There's nothing, never gets to the bottom of anything.
Okay.
I've had x-rays, there's a shadow, it's decreasing, it's increasing, it's decreasing. Chest has been getting tighter and tighter, and now it's just like someone's permanently got me in a sort of bear hug sort of thing, finding it really hard to breathe.
Fine, okay. Any fever?
No.
Or are you bringing up any phlegm?
Green mucus.
Okay.
Whenever I cough, I bring up phlegm.
Are you a smoker?
Yes.
Yeah, okay.
I've had the cough for a year.
Okay.
Over a year.
Have you been feeling hot, Yeah.
Yeah, sweaty. It's just like someone's just permanently squeezing on my chest.
Yeah.
It's all across here. I've always been worried about lung cancer because I smoke that.
Yes.
And the pain's getting worse and worse as the years go on. For over a year now, I've been backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
And where do you work? What do you do?
I work at a bar.
Long hours and things?
Yeah, that's what I've been doing, so I've just been getting really run down.
No, I work in kitchens.
What do you do in kitchens?
I'm a chef. So,
And where do you work?
I work in 3 places.
It's nice and relaxing.
Yeah.
What do you do? Transport planning. Right, transport planning. I think Bristol could do with a bit of transport planning.
You used to work in an oil rig, is that right?
Oil tankers.
Oil tankers.
It's been about 20 years ago, yeah.
How are you today? You all right?
Yeah, all right. I've been on my knees all day replacing floors. It's a dirty job, but someone's got to do it.
Indeed.
I used to be in the lifting game years ago. Removals.
There you go then.
Domestic and industrial.
The perfect job for you then.
Yeah.
Come on in.
Where would you like me to place it?
Let's go down this end, shall we? Then you
Okay.
can sit on that chair.
Yep, I'll do that. Is that right the way round or
It's
the other way round?
round, but
Oh,
never mind.
I should know that anyway, shouldn't I?
You should do after all
Yeah, I
this
should
time,
do,
shouldn't
yeah.
you?
I'm a little bit scrambled at the moment.
How's the leg?
Well, I haven't had any distress with it, I've got to admit.
Right.
But maybe I didn't have them up. But that's looking better, though, isn't it? I think. It's looking a lot better than it was.
Yeah.
I think being on the move all through the day has helped it out. It's
Yeah, it's getting there, isn't it?
it's a silver lining, like, you know.
Right, yeah.
Yeah, lovely.
Let's have a look at this then. So that's good, isn't it? Good. There we go then.
But I would think, what would you reckon, another week or two on this one?
Yeah, another week
Okay.
or two.
Well, all I can say to you is have a nice end to the week, have a nice weekend.
And you, yeah?
Yeah, thank you very much.
Okay, take care,
You
bye-bye.
Take care, thank you, bye-bye.
It's not located down this side like it usually is. It's all across the top half of my chest here.
The pain that you're getting now?
Yeah.
OK, yeah, OK. Are you working?
I'm plaster.
You're plasterer, OK. Have we wondered about whether your work has anything to do with your chest?
I've changed jobs. I was doing things like plasters. I wear a mask, I wear goggles.
Yeah.
I was set for the other day when I went to the hospital to get plaster washed out my eye, but yeah, it's like that. So I changed from building sites to private little home jobs now, working
Yes.
for myself. It's not so dusty, so.
And you've had a chest X-ray?
I've had 3 or 4.
Yeah.
I have to have regular ones.
OK. The X-ray I'm looking at, they've said that there are prominent markings in the left lung base again.
Yeah.
Respiratory physician opinion could be helpful. So have you been to the hospital to be seen?
I've had no appointments for nothing.
OK, all right. And have we done any breathing tests with you here?
I can blow perfectly all right on these tubes. Apparently I've got brilliant.
And have we ever got you to go into the treatment room to do some breathing
No.
tests? OK, fine. That might be just useful to do as well. And you've had blood tests?
I've had blood tests, I've had this, that and the other done.
Let me just do the usual sort of
Usual
check
stuff,
your
it all
oxygen
comes
level.
back properly and clear.
Oxygen levels are good, 99%, so that's good.
Always comes back the same.
87. Yeah. Do you want to, if you were to lift up for me, that's great. And just take some deep breaths. Just lean forward for me. And take some deep breaths again. Okay. I can't hear anything down here different. I'll give you some antibiotics today. If that you're bringing up mucky phlegm and you're feeling unwell. Any weight loss?
Weight gain?
Wait, have you been gaining weight? OK, OK. It sounds like we ought to be doing some more blood tests and some breathing tests and making a referral to the hospital for them to take a look at you.
Probably my lungs full of smoke.
Smoking?
Yeah.
Are you ever going to stop?
I tried one of those vape pens and my chest got worse, not better.
OK. I mean, ultimately, your chest would improve. It's better for your health overall to stop smoking.
Yeah.
Sometimes there is a really difficult bit when people first stop smoking. So there are...
I feel sick.
And that's probably the lack of nicotine, because it's the nicotine that's addictive.
Oh yeah, I want to stop smoking. Obviously I don't want to be a smoker. I don't want to kill myself, do I? I've got young kids. So
Yeah. We've got people trained up here to support people to stop smoking. We know it's hard to do.
I'm willing to give anything a go that makes me feel better.
And
What about the hospital?
I'll make a note to myself now to make a referral for you.
Thank you very much.
All right.
Thank you.
OK. Bye-bye then.
Bye-bye.
So if you say urinating, it's there now.
Oh, brilliant. OK, thanks, Cliff. Thanks for that. Cheers. Tanya's back on now, the phone, so you're all right.
Sorry, are you talking to me, Nigel? Just
I was trying to.
chewing a brick.
Hello there. I'm Dr. Bolam.
Yeah, hi.
And this is Harmen.
Harmeen.
Harmeen.
Yes.
Sorry. OK. OK, and she's just 4 weeks old.
Yeah.
And she's your third baby, is that right?
Yeah, she is. I've noticed this morning her nose was bleeding.
OK.
You can see this.
Oh, yeah.
This is bleeding this morning. But whenever she sneezes,
I see.
you can see it here.
OK. Are you breastfeeding her?
Yes.
OK. And is that going all right now?
Yeah.
I'll have a proper look at her in a minute. But how does she seem to you now? She seems well, does she?
She seems okay, but I just worried about the bleeding.
Yes. Okay.
Yeah. Yeah.
There's no rash on her.
Yeah. Her body was full of spots about 2 weeks ago.
And that's, in fact, getting better then.
Yeah,
is it?
yes.
Well, I'll tell you what, if you pop her on the bed and stay up there with her, and then we'll do a temperature and have a look in her nose and such like. OK? All right? Hello? All right? You doing some puzzles there? Very good. All right. OK. Right then, let's have a look at you then, madam. Hello? Hello, what's going on? What's going on? It's OK, so she's no temperature now. All right? 36.9. OK, right then. Is the blood only coming out of that right nostril?
I think so.
Like it is,
Yeah,
isn't it?
yeah,
Okay.
yeah.
Yeah, OK. Hello. There's just a little sore area on the edge of her nostril. All right?
Okay.
OK. I'm not worried about that. OK. All right, she's well. She's no temperature. There's no worrying rash. She's feeding OK. She looks great. All right?
Anything I can give it to her?
I would just keep it clean. OK? Maybe boil some water, let it cool, put a little bit of salt on it and just, bathe it a couple of times a day with some cotton wool. Okay. Is that all right?
Yeah, that's fine.
She's fine. Congratulations.
Thank you.
So you've got a boy?
And 2 girls.
And 2 girls.
Yeah.
OK. And you the biggest? How old are you?
about to be 10.
You're about to be 10? OK.
10 days.
Oh, 10 in 10 days. OK. Cool. And how old's your other sister? 8. OK, so Mum's had a bit of a gap there.
Yeah.
OK, so you're remembering how to do it.
I totally forgot everything.
Yeah. It's coming back though, is it?
Yeah.
OK, all right, so keep an eye on that. Obviously, if anything seems to get worse or she goes off her feeds or you're in any way concerned, you bring her back.
Thank you so much.
All right, no, that's my pleasure. Have a good birthday.
Thank you. Bye.
All right, bye-bye now. Bye-bye.
Thanks very much.
Good news.
I shall see you later if you're there.
Absolutely.
Thank you so much.
Good, nice to see you.
Thanks a lot.
Cheers,
Bye-bye.
bye.
All right, not a problem. OK, all right. Thank you. Oh.
Take care.
All right,
See you later.
cheers.
OK. Come on then. Are you going to stay with me? Come See all my patients. Bye-bye.
Bye-bye.
Managing how you choose to prescribe for any patient can sometimes be a challenge. If you have any sniff of getting a prescription from 2 doctors at the same time...
I promise you that's not going to happen. This is just a misunderstanding.
Promises don't cut it.
Patients who have a positive outlook on life are a pleasure to work with.
We have a laugh because just as they patch me up with one thing, I get something else. Always fancied a lobotomy.
Behave yourself.
think it's quite difficult sometimes to realise that there is only a certain amount you can do.
And I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
Does it hurt you when you go to a wee, Charlie?
No. He goes for a wee a hell of a lot. Why do you go to a wee so much?
Hey, Chris, how are you? Okay.
Farnham Surgery's been to Pam. How can I help?
Hello, it's Dr. Hyder. Come through and have a seat.
All right.
Fine, thank you. And how can I help you today?
Oh, I had a really serious accident on a Thursday. I got my legs crushed.
OK.
So...
At work or...?
At work, yeah.
Right, okay.
I was, hard to explain to everyone. I was sitting... it's not sitting down, but I was working with my legs in between 2 rollers and cargo systems. Somebody activated a lane and a pallet, my legs were sitting down like that, crushed my legs against the rollers. I can explain it to you. Just get out of the chair. So if I was, by the time the roller bed come, I was like that against the rollers.
Oh.
The pallets coming from behind and crushed my legs.
Right.
And literally.
That's me.
So yeah.
Yeah.
They would have been taken. It's 4 ton. So they would have taken them clean off.
Goodness me.
So it's a lot of it's psychological at the minute as well, because it's I get flashbacks on that. Scary. Obviously, I can't work at the minute.
You've got a lot of bruising there.
Yes,
as well.
it's coming out today.
And this cut as well.
No, this leg is actually not too bad.
But that happened at the accident.
That's just pressure. I mean, I had an X-ray on Thursday.
Did you?
Yes.
Yeah.
And there's no broken bones, but she said there's a hell of a lot of swelling.
Is it painful on the shin?
The pain, that's not too bad to be fair, but it's when I walk around, it's more internal. So I started to pinpoint where it is. It's only when I put pressure on it and weight in it. I can sort of walk around all right, I just take that for support.
Yeah.
But I can't get upstairs properly. My job obviously involves me climbing up ladders, steps, because I'm a maintenance electrician. So...
Yeah, can you bend your knee okay?
Yeah.
So the knee bit's fine?
Knee bit's fine. Here hurts. That really hurts there.
And the X-ray, there was definitely no fracture?
No fracture, no. You've got to think, my legs must have squeezed to the side of my arms.
It's unpleasant, isn't it?
It is, yeah.
So you need a sick note. Do you need pain relief?
I probably would, yeah. And something, anti-inflammatories or something, would that help?
Yeah, I think it's pretty extensive bruising, isn't it?
So
and
the bruise is
swelling.
coming out, so...
I think a couple of weeks would hopefully mean that the bruising will start to settle, but soft tissue injuries, they can take up to 6 weeks to resolve altogether. I've given you the cocodamol. You can take a maximum of 2 tablets up to 4 times a day. And then that's your sick note as well. So I've just written crush injury to both legs at work.
Thank you.
And we've done it from the 22nd to the 8th.
Thank you.
So if you're no better by the 8th, then come back and we'll see you again. And if it's worse, we can always see you soon. Yeah. All right.
Cheers. Thank you very much.
That's OK. Take care then.
Thank you. Bye-bye.
Bye-bye.
I don't want to waste 4 hours at Wexham Park, but at the moment I'm having severe facial problem and hitting my right arm, and I don't want to go to Wexham because I'm one of those patients that has fibromyalgia type things.
Okay.
So is there somebody I can get checked before I go?
Just a minute.
This is not affecting my voice at the moment. It's affecting my lips, my tongue. Normally it just goes down here. It started with a headache, which I've still got, and it's going down the left side of my body. Slowly but surely.
Have you had this before?
No, not like this.
Yeah,
Yeah, it's going slowly affecting the nerves down the side of my body. I don't know, that's what I'm worried about.
A month ago and said I was having a stroke, and I was.
It won't surprise me.
Okay, thanks. If you take a seat for me, and I will just quickly speak to the doctor.
Okay.
Yeah, thank you. Just knock. Yeah. Knock on his door.
Come in.
Hi.
Tell me.
She's
I don't know if she's having a heart attack, lady, but her whole left-hand side is going numb. She's got now a tingling in her tongue.
Let's get the ECG for her. Who is doing the merge treatment room?
Hello.
Alison, good afternoon. How are you today?
I'm good, thank you. How are you?
I'm fine, but one of my patients could be having a heart attack. I want an ECG done.
Okay then.
She is Karen Price.
Okay.
And shall I send her towards you?
No. Straight down towards 10.
Yeah, I'll take her there.
Thank you.
Thank you.
Thank
Cheers.
you.
Bye.
When she's done with that?
Sorry?
When she's done?
She can come straight.
Come here, yeah?
Yeah.
Okay, thank you.
I haven't had anything like this before.
Yeah. Your speech seemed to be okay.
I don't know, my tongue's all starting to tingle.
I mean, I know it's sort of the best thing to tell you, but I had a minor stroke a long time ago.
That's what I suspect this is.
10, 15 years ago. But I didn't know what it was, but my face started drooping from one side. I was really stressed, that's what I had.
Could you follow me? You okay to get up? Yeah? Sure. Don't worry, you can go slowly.
So just follow my finger, okay?
Stick your tongue out and waggle it from side to side. That's fine.
Open your mouth, show me your teeth.
Sometimes I can smell burning when there's no burning.
Okay.
Are you checking that I've had a stroke or something?
Come in. Hello, come on, have a seat.
There we go, thank you.
How's it going?
Right. I've been having headaches on and off for a little while. And today I had one at about 5 to 2. And as I was driving home, I got a pain down here. And it's now getting gradually worse. And my arm and leg don't feel...
Is it feeling very weak?
It's not so much weak as though it's not quite there.
Quite there. When you had previous heart attacks, what were the symptoms like? There was mainly chest pain, wasn't it?
Chest pain. This is nothing like...
ECG is absolutely normal,
that's what the nurse
which is good news in a way. Have you lost up any power in your hands and legs, or it just feels like that?
It just feels they're lighter than this side.
Okay. Can I have a quick feel of what's going on? Examine you.
Yeah.
Try squeezing my fingers tight. Tight, 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 tight. Okay. In any urgent or emergency situation like this, it's important for a healthcare professional to be level-headed and calm, mainly because patients are in a state of anxiety. Okay. Push me away. Pull me towards you. Like this. Hold it like this. Push me towards you. That's good. Okay, I'm just going to quickly have a look at your eyes. Quite often, it's very easy to succumb to the pressures of the emergency and get the anxiety and the fear transferred onto you. And then the patients won't be reassured and they will lose the confidence in the healthcare professional. Hence, I was calm and level-headed. Close your eyes tight, 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 tight. Good. Clench your teeth for me. That's good. Oh, thank you. Sorry about that. So mainly at the moment, it's like headaches on the left side, tingling sensation, and feeling weak.
Yeah, I'm tired. It's like somebody's hit me with a baseball bat on the side of my face.
Thank you. Based on your symptoms and the scoring system, it would put you on some risk here. We need to exclude if there is any phenomenon like mini stroke. It might be worthwhile speaking to the High Wycombe Stroke Centre what they think we need to do. Is that okay?
Yeah.
Thank you for your call. We are experiencing experiencing a high volume of calls and all available operators are busy. Please hold and your call will be answered shortly.
Doesn't seem like we're having any luck today.
So if you are having a stroke then?
Well, if there are fast symptoms like complete weakness on one side, tingling, facial droopiness and everything, we advise patients to call 999. High Wycombe is the stroke center. That's where we get on-the-day investigations like MRI scan and everything. That probably is the way forward. As soon as they see this letter and everything, they'll be happy to see in High Wycombe anyway. Is that okay?
Yeah, yeah.
Shall I give that to you?
I'll take that. Thank you.
All the best. Hopefully it's all going to be okay, all right?
Okay.
Take care. Bye-bye.
I've got bloody animal fleas on me. Little tiny animal fleas. 2 of them just jumped on me. I don't know where they're from. Well, they're from somebody. You've got birds and squirrels and chipmunks. You're not enjoying any of it, no?
At the moment, I'm not. I can't. I just can't even get outside.
Charlie Williams, please. Hello there.
Hiya.
Come in. Sorry to keep you.
That's all right. Sit down.
Hello, Charlie. He's had some pain.
Yeah, lower abdomen,
Okay.
right in the middle. Now, he's had this a couple of times over the last month or so, but it's not been to the extent that it was this morning. It's coming again. He said the pain is always there, but it like spikes.
Yeah.
And then he's doubled over and it's like cramping and stabbing.
Yeah, okay. And when you do a wee, does it hurt you when you go to a wee, Charlie? When you do a wee?
No.
Doesn't sting. Good.
He goes for a wee a hell of a lot. Like, he'll go in the space of an hour about 5 times. I'm like, why do you go to the wee so much?
Sometimes boys, their bladders are slightly sort of weaker than women's, and you find that they tend to sort of go and they sort of get out of that. Now, if he's not getting any pain, it's unlikely to be an infection, but I think it's worth trying to get a urine sample at some point and bring it in so that we can test that. You haven't had any diarrhea when you've been to number 2?
I have had one.
That was a couple of weeks back.
Oh, a couple of weeks ago.
1 week ago.
1 week ago.
1 week ago?
No,
okay.
I think it was a couple of...
I had to have toast.
It hasn't been constipated. It's not been like when you've gone lots of little hard things and difficult to get out.
No.
No. Can I have a look at you and your tummy up on the table? Shall we jump up? Let me get this for you. Good man.
That's a good
Lie down. Good. That's good. Just open wide for me.
It was really warm this morning, actually. I've given him some Nurofen.
Relax. Just check his temperature and open that up. Okay, that's fine. And then that way. 36.4, so that's okay. Let's have a little feel of this tummy. A wee bit sore down here. Sorry. Have you had lots of wind? You're a bit windy, aren't you?
Yeah.
Yeah. Come and sit up again now. He's obviously getting some crampy pain and the bowels are quite active.
Okay.
So it sounds a little bit more like he may be getting a little bit of a bowel infection and he may end up in a bit sick or get some diarrhea again with it. Sometimes very early things like appendicitis can present just with general tummy pain. And at the minute, there's no indication that that's what it is.
Good.
I would continue doing what you're doing. Give him some Nurofen.
Okay.
A little bit of whatever he fancies to eat and a little bit of fluid every so often.
Don't tell him that. I'll be asking me for ice cream for lunch.
Yeah, whatever, in a sense, whatever he'll take. If he's getting worse or going downhill, bring him back this afternoon so we can just do a double check and make sure it's not anything like appendicitis or anything. But if you can get a urine sample, it's worth just, if you do, dropping it in so we can just check.
Got a pot or anything?
Yeah.
Thank you.
What am I going to have to do?
Oh, lovely.
Okay, young man.
Say thank you to the doctor.
Thank you very much. Pleasure to meet you.
Okay.
Okay.
Brilliant. Thank you so much.
Okay, not at all.
Cheers.
Well done,
Come on then, what ones? Right, look.
Sorry, doctor.
It's okay, Leslie. Come on in. Sorry, I'm running late. So, last time I spoke to you, I got you in to see Dr. Javed because you said your chest was worse, yeah?
What did they say you've got? What's your diagnosis?
Avian lung disease.
Hypersensitive to birds.
Well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds, which I can understand was giving me this problem.
They think that you've reacted to the birds and they think that there's damage in...
Well, the blood tests show that he reacted to the birds. I've seen it on the screen.
Yeah, exactly.
He
So-
keeps saying it's not the birds, but...
What I mean is that they think there's some damage to your lungs because of the exposure to the birds. Yeah. Okay. So we need some advice from the chest physicians about how we move it forward. So that's the one that we can't get you an appointment. So twice we've got them to rearrange it, and twice they've cancelled it. I can keep chasing.
I told him that the doctor can only do what she can do.
Yeah. So what I can do is escalate it, and we've escalated it from this man's appointment was cancelled because of the doctor's strike and you haven't booked it, please book one, right the way through to an urgent referral being faxed.
Yeah. One of my main concerns at the moment is his
mood.
His depression. This man is getting more and more depressed every day. He's been my friend for a long, long time, over 13 years. He talks suicide, he talks all sorts of things, and I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
What am I going to do? I mean,
It's two things. Yeah, there's the depression because you're feeling so ill, and there's the fact that you're on a high dose of steroids, which will make you depressed. And every time we try and reduce your steroids, your chest flares up. If I could stop your steroids, that's what I'd do. But every time you try and drop them, you really struggle, don't you? We've spoken before about the fact that they won't constantly do scans and x-rays, but what they need to be doing is deciding what they need to do. Yeah? What I want them to do is tell me about your medication. Yeah, because I think that if we could change the sorts of steroids you're on or reduce the amount of steroids you're on, then I think that a lot of the other symptoms would improve.
But the trouble is, one of your biggest things is you do just need to. I know it's very hard, but you need to just relax about what's going on around you medically.
It's very hard
because
when you're
but everybody's doing the best that they can do.
Well, you know that, don't you?
It's very hard on your own because your head you start thinking the worst all the time. I seem to think the worst.
Well, that's been one of what they think you have would account for your symptoms. We're just really struggling to control them at the moment. From the point of view of chasing the chest physician, I will do it again.
Thank you very much, Doctor.
And I'll see you then.
The way I am.
No, it's fine. It was nice to meet you, Pam.
I mean, he just gets very frustrated, and I mean, I know he's got all these things, but a lot of his things are exacerbated by anxiety. I know they are. Bye, nice to meet you.
Bye-bye.
How are you doing?
Yeah.
Let's take a seat. So, there's a few problems.
Yeah, I heard.
Yeah.
I've sorted it out. They were supposed to have a script for me just in case I didn't get what I got from you. And like I said to you, they only give you 5 minutes, and I said to them, yes, I got from Dr. O'Donnell, but you only gave me up until the day I got to him.
But the doctor says that...
I know, I chatted to the owner.
You told them you hadn't seen a doctor here.
No, I told them I have.
2 weeks before this consultation, Yasser came back to the practice and saw me after an absence of 2.5 years. He told me that he had moved back into the area, and so this was the first time that I'd seen him. His problems are dependence on opiates and benzodiazepines. The reason he came to see me that particular day was for his prescription for diazepam. But he omitted to mention that he'd been to his previous GP 3 days before and had gotten a prescription.
She's trying to say, I've got a script from there and I've got a script from here. And I said, it's not right, it needs to be sorted out.
Why did you go back to Dedworth at all?
They rang me and said...
But you should say, I've moved to a different practice, I've read
I said that. I said, it was about the script.
Yeah.
They said to me, come get the script. And I said to him on the phone that I don't need it. I'm with Dr. O'Donnell, because she phoned me and said, no, you've got 2 scripts. And then I was like, what? And then I went there and then sorted it out. I took my dad with me because of proof. And then he went in and then he chatted as well and goes, look, my son didn't do that.
Well, It does look very suspicious. It damages trust.
Morning, ladies.
Morning.
I have an appointment, Walter Godley.
Take a seat next door. Take a seat next door.
Thank you.
Seeing lots of gentlemen today.
Sorry?
Seeing lots of gentlemen today. It's making a change.
So this is your third one?
I've switched off because of the children in there.
Yeah, it gets too much.
They're a bit noisy.
What do you want to see the nurse for?
Because I can't hear.
You can't hear? Right.
How are you?
I can't hear a thing.
All I can hear is like a whining noise.
Yeah.
It's Dr. Bajwala.
Is it a lady?
It's a man.
Yeah, man.
Right, how can I help you today?
I've lost my hearing right here.
Right.
Part of my hearing right here.
Sorry, what happened?
Sorry?
What happened?
Saturday or Sunday, I put my finger in my ear and a brown blob of wax came out of my ear. And then maybe Tuesday morning, the hearing sort of like went about 90%.
Okay.
Last night it just kept going and coming and going and coming.
Is there any discharge? Why you put your cortisol?
Not since the weekend.
Okay, so what's the reason you've had your cortisol still there?
The wife put some olive oil in last night.
Oh,
and said,
okay.
Don't take it out.
You should never put the cortisol because it will absorb the oil. Okay, let's have a look. So have you taken any painkillers?
Sorry?
Have you taken any pain relief?
Yeah, I'll take some paracetamol. No, it didn't work.
Do you use earbuds?
Sorry?
Do you use earbuds to clean your ear?
I did try a weekend.
What, with this year or that year?
That year.
Okay, so you never...
I've got no problems that ear, except for partial deafness anyway.
Yeah, because your ear looks a little bit perforated. Let's have a look here. Never use cotton buds.
Oh.
It looks a little bit infected as well. Okay, there is a little bit of infection there.
Oh.
Sorry. So what I'll do is I'll give you some ear drops. It looks a little bit infected.
Sorry?
There's an infection there in your ear. So I'm going to give you some antibiotic ear drops and some pain relief. I want you to come back and see us next week, Monday. There's a little bit of cortisol hanging out. Let me take that off. Yeah, so take some paracetamol. If that helps, carry on. If it doesn't, come back and see us. Okay?
So you want me to make another appointment?
Next week. Anytime
Do you want
next
me to
week.
make an appointment for next week, or do you want me to make an appointment next week?
Make an appointment next week.
So next week, if it's still there...
No, we still need to see you.
Do you?
Yeah.
So I'll make an appointment now?
Yeah.
Make
Before
an
you go.
appointment for next
If you
Wednesday.
can, yeah.
I'll do that.
All right?
All right, thank
Take
you.
care. Bye-bye.
It does look very suspicious. It damages trust.
I can regain the trust and I could bring my dad here. And
No, it's not your dad, it's you. The trust has to be with you.
Yeah.
Because, if there's a hint that you may be working the system.
No, I'm not.
No, but if there's a hint that so it is up to you to make sure that everything is absolutely above board and that it seems as if it is, that it's apparent and clear to everybody that it is above board. But if there's something that's not right about it, then that interferes with the trust between you and me and between the trust between you and all of the doctors who are available to help you. And so...
I'll promise you, I will... If I get medicated, I'll promise this will not
Well, you can
happen,
promises...
I'm saying it's... I'm away from there.
Yeah, well, promises don't cut it. We have to be sure, in terms of safe prescribing, that that's what's happening. Managing how you choose to prescribe for any patient can sometimes be a challenge. In substance misuse, sometimes people are in this situation because they're afraid of being without their medication. Duplicity or deception isn't what they're trying to achieve, but it's their way of making sure that they're not going to go without. Our concern is not so much the deception, it's making sure that they're not unsafe and that in particular we're not contributing to a reduction in safety in prescribing. The point is that twice, on 2 occasions, you've gone back to Dedworth after you've had medication prescriptions here, and you've said that you didn't get a prescription here. And that Twice, yeah.
No, that's impossible.
Well, I'll have to check this out because I can't issue a prescription unless I know what I'm doing. Do not go back to Dedworth again. If you have any sniff of getting a prescription from 2 doctors at the same time.
I'll promise you that's not going to happen. This is just a misunderstanding.
And what we'll do is we'll need to put you on daily prescriptions. I know, but this is not my doing. This is you messed up here. And if you continue to do this, then we have to go down this route anyway, because there's no way out of this. So
I have to come every day?
No, you have to come to the pharmacy every day and pick up. And if everything is going well, then we can begin to relax the control. But that's what we have to do at the moment.
Thank you very much, Doctor.
You're welcome. If they've any problem, they can ring up from the pharmacy.
Yeah, and you can keep a check if you...
Yeah, I will. I'll be watching it closely,
I want you to regain the trust with me because I've known you for a long time.
It's important,
it's important. I want to keep that trust. I don't want you to look down on me.
No. I wouldn't. I'd never look down on you anyway. This is just purely a question of trust.
Yes, that's what I'm getting at.
It's really important you don't mess up.
Yeah, so I'm going to prove to you that I wasn't. And
Do.
We'll take it from there.
Yeah.
Thank you very much.
Yeah.
Thank you.
You take care.
I'll see you in 2 weeks.
Yeah, absolutely. Yeah.
I used to sing in school.
Did you?
I used to be a big Britney Spears fan, so if we used to go places and then if something was getting delayed, my teacher would be like, go off stage quickly and sing a song. Oh my God.
I'll sing us one song.
No.
Please.
No. I was in dancing as well.
I remember when my eldest joined the choir and she was tone deaf and I said to her, mine. Don't sing, just mine.
How can I help? I had a lot of issues with my stomach. It was diarrhea continuously. Last 3-4 weeks I was suffering. Okay. The doctor done some test. The stool. That's correct. And still same issue because I was suffering with overactive thyroid, but my thyroid levels are perfectly fine. Good. Because if the thyroid levels are played up, that's what happens as well. Then it's another issue might be. Still, I'm in the same issue. It's not getting better.
Okay. Your stool sample was clear, so that was good. Okay, but let's go through a couple of things. How long has the diarrhea been going on for now?
We're talking about 1 month now, isn't it?
Okay. And 4-week history of diarrhea. How many times a day are you opening?
Oh, Christ, sometimes back to back. 6 times.
6 times a day.
Easily.
6 times per day. Any blood or mucus?
I didn't see it. I should have, but I just...
Any vomiting?
No.
Any tummy pains?
When I have to go, start rumbling. I'm ready. It tells me, come on. That's it.
You need to go and over.
Yeah, that's it.
And then you
after that,
after you
and then after, just calm down.
Any weight loss?
I tried to lose weight anyway, which I successful because last year I was 95, and now I'm 85 now, which is I want to do it because I cut down all the processed sugar and everything for my...
And you've been exercising as well?
Exercise, I do lots of exercise, yeah.
Okay. And have you been abroad recently?
No.
And anyone in the family have any bowel conditions like inflammatory bowel disease? Ulcerative colitis or Crohn's? Can you have a feel of your tummy? Just going to gently press. No pain anywhere in the tummy? Nothing. That's good, okay. One of the examination that we should do if someone's getting persistent diarrhea is examining the back passage to make sure that there's nothing worrying that we can feel in the back passage. Are you happy for me to do that today? Yeah. Okay, now what I want you to do is lie on your left side and bring your knees up towards your chest, okay?
Hello. Come through, have a seat.
Thank you.
How are you?
Everything was fine today, yesterday.
Yeah.
I've seen the midwife, community midwife, because I just gave the birth 3 days ago.
Congratulations.
Thank you. So everything was fine, but my boobs, they're a little bit swollen. And what she says probably is infected.
Okay. So they're painful and they're swollen?
They're painful, they're swollen, they're big.
They're getting red?
Slowly but surely.
Okay. Any temperatures?
I don't know. I didn't check it, I'll be honest.
Okay.
I was so
Do you feel well?
I feel okay, but it's painful. It's very painful.
Are you breastfeeding?
Not now, I think, because I'm just scared to do it.
Okay, but you have been?
Yes.
So you've been expressing milk?
Yes.
Ah, okay, fine.
Okay, let's just check your temperature. And baby's okay?
Baby's okay. She's doing well. So I can't complain about baby. It's just me.
Perfect. That's normal. Do you want to come behind here? Okay, I just need you to take everything off, including your bra. Just sit on the couch, okay?
They're so big and wet and painful.
Okay, I'm going to have a feel. Okay.
Already they are painful.
All of them?
Mm-hmm.
Very swollen, aren't they?
Mm-hmm.
And tender.
And I have to say, yesterday was like half. Today morning is like double everything.
I think this one's worse than this one. This one still has some...
It still is painful. For me, it's both same if it's about pain. Maybe it's...
And the milk's coming out okay? Sorry, just 1 second. It's coming out okay? Yeah?
Mm-hmm.
That's fine. Get yourself dressed. So, yes, they are swollen, they are tender, and they are slightly red in some areas and very warm to touch. So I'd like to give you some antibiotics just in case there's an infection going on. So I'm just...
I don't think so. I can cope another day.
Okay. It's 1 tablet 4 times a day.
Okay. So if I had the antibiotic, can I still feed the baby?
Yeah. The one that I'm going to give you is fine to take while you're breastfeeding, okay? So it's absolutely okay to do that. If they're not getting any better or it's still the same, you need to come back and see us, definitely, all right?
Okay.
There you go. All right.
Lovely. Thank you so much.
No problem. Bye-bye.
Thank you.
Bye.
Okay. Essentially, it was reassuring. Okay, so when anyone gets persistent diarrhea, there's lots of things that we think about. Okay, so obviously one of the things that we've got to rule out is infection. Okay, and normally, like I said, it settles down, but it's good that we sent the stool sample off. There was nothing that was shown in that stool sample. The other thing that we think about is inflammation. So there is another stool sample that I want you to do to look for inflammation in the bowel that can cause these types of symptoms. Does that make sense? Okay. Yes. The other thing, of course, that we think about is anything worrying going on, okay? And normally it would, there's lots of different signs and symptoms. So persistent diarrhea with blood, weight loss, etc. Does that make sense? Yeah. And there's a couple of other blood tests that I want to add just to make sure that we've ticked all the boxes to make sure that we've investigated you thoroughly. Does that make sense? After these investigations, if the symptoms persist, then we may need to get you up to the gastroenterologist specialist to have a look and see what's going on.
Okay.
Lovely.
Doctor, thank you.
No trouble.
I need to get to the bottom of this
yes, absolutely.
issue.
So I'll see you in 2 weeks. If yourself, I'll see you in 2 weeks and then we'll move things forward from there. All right, then?
Thanks.
No trouble.
Thank you.
Lovely. Lovely to see you. Bye-bye now.
Trying to avoid that big blood vessel.
So it's painful.
Oh, yeah.
Oh my God, no, don't go any further, please.
That's really hard.
Oh my God, no, please.
Okay,
oh.
so it's aggravating. I'm sorry.
How can I help?
Oh, just a couple of things really.
Yes.
First thing, I was in hospital again
Yes,
at
I
the weekend.
read.
The week before I was in, then again at the weekend, and they actually tried me on different antihistamines, domperidone.
Oh, yes.
I've got them here just to show you, make sure I got the name right.
Yes.
They actually gave me some that were out of date, so I needed some more.
Okay.
I don't know how, there's so many they have to deal with, but just it worked quite well because cyclizine makes me feel a bit sick before I feel better. But apparently these have their side effects as well, so I'm quite keen to try them.
You can, but in some people, these can have these kind of psychotic episodes where they get certain spasms of the neck and that kind of thing. It tends to happen more in children. I can give you a short course now, but I think it's for when you have the flare-ups.
Yeah.
I think long-term, stick to the cyclizine safer. Yeah.
Tolerance to the other two.
Samantha is a 24-year-old patient of mine with ongoing chronic abdominal pains. She's under a hospital in London with the gastroenterology team undergoing numerous investigations. However, she's still getting these chronic intermittent cramps.
Because I'm on a lot, I'm on tramadol, morphine as well.
You're on, so I've got hypropranolol. Are you still taking Buscopan?
Yeah, 8 a day.
Are you still on cocodamol?
Yeah.
Amitriptyline?
Yeah.
Lansoprazole?
Yeah.
Citalopram?
Yeah.
And do you still need the Cosmocol?
Is that the Movicol?
Yeah.
Yeah, I've got some at home in the hospital, gave me quite
So
a
if
lot
I go
of
to add drug, it'll tell me whether these will interact as
So
well.
I'm on tramadol and I'm on morphine as well.
See, there we go. So
Oh wow, yeah.
But basically, having amitriptyline, citalopram, and domperidone, these affect the heart. Basically, that's the other side effects.
How often do you have it dressed, Queenie?
If you feel something sharp, tell me and I'll stop.
Yeah, I can slightly feel that.
Oops.
Actually, on my legs then.
Right, so there's quite a lot of discharge under dressing.
Come in. This is Holly.
Hello.
She's with us for the afternoon.
Right.
Alan, could you sit up on the couch, please?
Yeah.
Just saves me bending down.
Of course I will.
Lovely.
But without being, just Holly know I've got to drop your trousers, you know.
I'm happy if you are.
Right, how's the legs feeling?
The right leg is on its 4th week, isn't it?
Yeah, 4th week.
If you have a look and you say it's okay, then I'm still on my 6-week plan. But the left leg is still a little bit oozy, but not much.
Alan has a condition called lymphedema. Lymphedema is a disorder of the lymphatic system whereby fluid is not being drained away from the tissues adequately. This can happen in any part of the body, and in Alan's case, it's in his legs. Alan's condition is lifelong. However, he has a very positive outlook on life.
Coming in for dressings regularly? Yeah. For a year and a half?
I used to come in every day.
Down to once a week now?
It's once a week
now.
It used to be every day, and Sheila would run and hide.
OK. So you're just having it put on like this with the yellow line over, are you?
Not on the right leg.
No, on this, we're just doing the left leg.
What that is,
that
they
leg.
put a little bit of the green.
Bit of green.
OK.
And then they've been putting the padding over the top of it.
Sure. It's really helpful if patients have additional support at home or family that will help them at home. Initially, Sally was doing some dressings at home to save Alan coming on a daily basis. And this was also freeing up appointments at the surgery for other patients that needed care.
So yellow lines just sort of essentially to hold it all on like a big sock.
Yeah. Right, this is my problem because I haven't got the strength.
Do you want me to get some gloves on and hold
Thank
things
you.
in place?
Yeah. Maybe pull at the top would be
Yep.
easier for me, thank you. That's fine. OK.
That's fine.
Oh, dear.
I'm just watching.
Do you want me to do the second leg?
No, it's fine. It's fine. Thank you.
I've been thinking about cake, and I've decided that I have to give cake a miss for a while. But I enjoy looking at it, but I'm resolved not to eat cake this afternoon.
So we won't force it on you.
Thank you. This is a bigger shock than Brexit. Yeah, Jim refuses cake. Yeah. It's such a shame.
I don't understand.
Look, this, I understand this. I have to slim down. Yes.
When was the hospital admission again?
I got out on Saturday, so I went in Friday early hours.
Is it for tummy pain?
Yeah, same as always. In the
Is it right or left side?
Right side,
Right.
yeah. They think it might be a valve for my pancreas, but they're not too worried about it yet. They're trying to get the pain under control.
Oh, the sphincter of the valve.
It's
and
been
the,
for 4 years now. They're trying to get the sphincter problem under control. If it is that, I'm seeing Hannah Smith on Monday to sort of get more.
So follow-up women at Hammersmith Hospital, is that next week?
Yeah, because I had Botox injected a few months ago now, beginning of April, and they want to see whether that helped or not. It hasn't, but they need to discuss
Where
it.
you had that
In
injected?
Hammersmith, they did an endoscopy, went back in, injected the sphincter muscle with the Botox.
Oh my goodness.
But it was trial and error, it's quite a new thing. Nothing's eased with the pain, but I was willing to give it a go. So now they might decide to inject more, or they might decide to try another treatment now. So touch wood, I'm just hoping something eases it, just so I can get back to work, you know. Just I want to get back to normal.
What do you
really.
do as your job?
I was in an office, I had a little office job, customer service, because I like talking, it was really good. But I had to let go. I was a liability on my painkillers. I was not well. I had to let go.
And on these medications, are you driving at the moment?
No, I can't. I don't want a biscuit. If I have an accident, I'd feel so
Yeah, because some of these medications can make you drowsy, so we always have to advise against operating machinery or driving.
Yeah, that's one of the reasons why I had to leave the job, because it was in a warehouse. So obviously the machinery was going around and everything. It wasn't for me, you know.
Samantha is on numerous medications to help alleviate some of her pain. Some of them are to help her nausea, some are to help relax the bowel. Other medications she's on are opioid-based like cocodamol and tramadol. One of the concerns that we have in treating young patients with long-term pain management therapies is that they can develop a physical dependence and even an addiction to certain opioid-based medications. Therefore, it's really important to keep these as a short-term use only at low doses and eventually try to wean them off these medications. And you're not taking any other illicit drugs, anything over the counter, herbal, nothing like that?
I try like multivitamins, but just to try and boost my immune system.
At the moment, carry on with the propranolol, the higher dose. I can see on the last consultation with one of the locum doctors that they put you up to 20 milligrams. Carry on with that 3 times a day. I gave you we increased your citalopram to 40 milligrams.
Yeah, I'm happy on that now.
So carry on with that, and I think let's see you again in 4 weeks' time with that.
Please, yeah.
With the domperidone, as I said, it can affect the heart. There is side effects. I'll give you 7 tablets just for the 1 week now, and then after that, carry on with your cyclizine. Is that all right?
That's fine, yeah.
So just use them in an emergency if and when you get a flare-up. Is that all right?
That's fine. Thank you.
So let's do that.
It's just sort of keeping me comfortable to find out what's going on, you know.
Sure. There you go. Take care. Nice to meet you again.
Oh, thank you.
Oh, take your time.
Straighten up. Thank you very much.
Take care. Bye.
Do you want a job, Sally, over the summer?
I've got 2 weeks off. Friday Friday night. Well, if you ever get stuck over the next 2 weeks,
Bless you.
just let me know and I'll come in and help you.
We have a laugh because just as they patch me up with one thing, I get something else. I was rushed in for a triple bypass.
No.
Yeah.
We still can't get rid of him that way, can we?
Yeah, as soon as they're healed, I'll think of something else.
Oh, jeez.
What was fancied a lobotomy?
Behave yourself. I remember when the very, very, very first time you
That was
came.
you and Dr. Morris.
And I hadn't been here that long.
No. He made that drastic mistake, didn't he? He said, oh, God, shit, I think we better book him into our surgeries.
Forever.
Forever, by the looks of it.
And he wasn't wrong.
Done.
All right then.
Good job.
Right, is that it now, Sheila,
That's
for
it.
another 5 months?
If only. Right, so,
Have we got an appointment for next week?
Yeah, another one at 2 o'clock in the afternoon. Yeah.
right, I'll have a look and see if that's me. I might just have a day's holiday. Right. Lovely to see you. Lovely to see you. Do you?
See you later.
Bye. Bye.
Bye.
I'll just leave the door for a minute.
Yeah, no, it's hot.
Because you have to put full stretch on it.
Yeah, yeah.
It's hard work.
Bye-bye, little man. Superstar. All right, there you go. Bye-bye then.
Thank you very much,
All right.
Doctor. Yeah,
Okay,
thanks very
nice
much.
to see you.
Yeah,
Thank
bye-bye.
you.
Right, thank you very much.
Best of luck, okay? Have a good trip. Bye-bye. Take care then.
Have a good day.
Bye-bye, you too.